CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences.
Welcome to the 8th Chiang Mai University International Medical Competition. I'm Chachaya Nangsu, or you can call me Namning.
Good morning. My name is Nachanon Pongnoi, or you can call me Sun. Now, I would like to introduce the first 10 teams of the first division coming up right up to the stage. The first team is Amon's On. Coming up next is Anatomy Rabbit. Next in the row is Hippocampus is Crying. Next is Lucky. And the fifth team is Med-ICM.
Please welcome Med RSU, Med SWU, NMU1, Beung Tang, and last of all, Tridents. We are delighted to welcome you back to the first on-site competition after last year, unfortunately being online due to a coronavirus pandemic. Now, you guys will get to go through the exhilarating rounds of the contest whilst making long-lasting memories and connections with medical students alike through our immersive tour and activities, including a traditional Northern-style Kantok dinner and extravagant welcoming party, so you can have fun discovering the historic wonders and cultural magnificence in northern Thailand. The competition consists of 5 rounds: the MCQs, quarterfinals, resurrection, semi-finals, and the finals. So, what stage of the contest are we in right now?
Right now, everyone, we are in the very first stage round, right after the MCQ. Please let me welcome you and every competitor to the quarterfinals of CMU-IMC 2023. First thing first, I would like to congratulate all of you for passing through to this round, the quarterfinal, or what we call initial incision. For initial incision, 2 teams will go to the semi-finals and 3 teams will continue to do resurrection. Now, before we begin our exciting competition, I would like to first introduce the panel of judges who will evaluate your guys' performance for this morning and the entirety of this stage round. We are honored and privileged to have with us today Assistant Professor Dr. Manasaporn Pasara from Department of Anatomy. Assistant Professor Sikrai Rawattanapong from Department of Anatomy. Dr. Suthira Narakornsak from Department of Anatomy. Dr. Natnisha Kampan from Department of Anatomy.
Please welcome from the Department of Surgery, Dr. Chanon Sihakulang. From the Department of Orthopedics, Dr. Pavi Chalida Pong. And 2 professors who will be answering via Zoom, both from the Department of Internal Medicine, Dr. Shutitep Tikaput and Dr. Chayasak Wantaniya Wong. These are our 8 respectable adjudicators for today.
And introducing the quiz master for this round, Miss Ramida Jangnun and Mr. Kavi Pairotanachai. Everyone, Before we proceed, our team has prepared a video to explain the procedures and rules of the quarterfinals.
Sit back, relax, and enjoy the video. Just a second, we will be with you shortly. So, how is everyone feeling today? I'm sure the atmosphere is a little bit stressful, but I'm sure you're all excited for this round. You guys have made it through this far, so do your best and good luck.
This is the first round of this time, right? First round of the stage round. I can feel the intense heat and the sense of excitement throughout this hall.
I can't take the anticipation anymore.
I agree. Now our team is working really hard to solve the problem, so be patient, everyone.
The video will be coming soon. Since it's super exciting, it might take just a little bit to come out to greet you guys.
That's right. And of course, for an emergency, we have our dear friend here who entertain you meanwhile before we are coming with our video.
Just for a little laugh, anybody want to relieve some stress and dance along?
It's okay if you may stand now and dance along with our skeleton guy.
Just don't dance along during the competition round, you'll distract the contestants.
What a great strategy.
I'm kidding.
I wonder what is the song that he's dancing with.
I'm actually very proud of our medical students here today, both the contestants for joining us and our staff who have been working extremely hard for over the past year. Both on designing the competition, as I myself am into, and all of the staff looking after our contestants. I'm really proud of all of us for putting in the hard work. So today, we're really just seeing all of our hard work coming through.
Yeah, I think yesterday was sort of an relaxation day, right? To warm your guys' energy up to this day. Yesterday, a lot of team have went to kantok dinner, right?
Yes, it looks very delicious and exciting.
Yeah, I saw some dancing animals, white furry animals, which I'm not sure what to call, but that truly is an excitement for yesterday.
You guys also saw the elephants.
Yes.
And actually, people here in Chiang Mai and other people like I myself who came from Bangkok but have been in Chiang Mai for about 2 years now, I haven't even gotten that close to an elephant yet. So this is really such a good opportunity to come here and not only just compete and make new friends, but also to indulge yourselves and experience the culture in northern Thailand, which you will not see anywhere else.
You know, seeing those big elephant in the picture, they are big. But once you're getting close to it, they are truly unimaginably big. And they are playful too, right? I mean, they use their trunk to like wrap around you, poke you a little. They're such a lovely animals for Chiang Mai, right?
And here, one of the most culturally appreciated locations or tourist places here in Chiang Mai that is well known for is its many temples. There's such a
Yes.
myriad and a variety of temples, both made from silver, from wood. You actually don't see those anywhere else in Thailand, only here.
I think Chiang Mai is a mix of culture. It consists of some sort of Thailand, but there's a sense of international culture is everywhere in Chiang Mai, right? In the temple, you can see that it's kind of different from the temple right in Bangkok or even in the southern region of Thailand, right? The use of the sand, the textile of the monk that they use, and the statue of the Buddha, the art in it, I think it's a truly one-of-a-kind experience.
Yeah, I see you're very knowledgeable.
I used to do an assignment last year. My favorite temple is Wat Umong. Umong in Thai means it's mean a tunnel. So there's a temple in a tunnel. It's
I
kind
heard
of.
it's very natural too, right?
I think it's natural, yes, of course, but one important thing is it's surreal, the quietness, the bats in the cave, and that sort of thing.
Very tranquil, but hopefully you don't run into the bats.
No.
Histoplasmosis, am I right?
Yeah, but it's a good place to meditate, think through everything, and just think through some of the anatomy that we're going to see today.
It is. So hopefully some of you guys made it to the temples. Maybe make some merit for today, pray, meditate.
Talking about art, talking about elephant, there's one more thing that I reminded myself of. กางเกงช้าง กางเกงช้าง it's such a phenomenal thing and it's something that you truly cannot miss. I mean, for Thai people, it's a symbol that you're truly a tourist. But if you're going abroad, let's say you go back to your country or your home, you know that, yeah, I have been to Chiang Mai.
It's a keepsake, isn't it? To
This-
show off to everyone.
That's right.
Chiang Mai is truly a place for people of all ages and all cultures. There's
Yes.
something for everyone. Both temples, ancient culture.
The food,
Obviously, Thailand definitely known for the food.
Talking about food, it's not only the cultural or the traditional food. Chiang Mai has a lot of great coffee places, and some of them are authentic. So the coffee is being brewed here in Chiang Mai, and some of the seeds are being grown here, by a local farmer. And it's very good. It's a
Right.
great
There's
time.
also one kind of vegetable that is extremely well known in Chiang Mai. It's
yeah.
called Chiang Da Pad Khai. This is a
Ah.
dish. It tastes great. You can only find it here, so make sure to try it here.
It's healthy, it's great, it's wonderful. We got coffee, we got food, we got good sightseeing. And
Yeah.
something that I think I might forgot to mention is Doi Suthep, a true pinnacle of Chiang Mai. Right? You just could not imagine a picture of Chiang Mai without a gigantic mountain in the background of your thoughts, right?
Of course, because it's a temple and a monument, basically. And that's why Chiang Mai University has a tradition every year for their freshmen to run up the mountain. I'm not sure how many kilometers, but it takes about 5 hours for our freshman students each year to run up to the top of the mountain to the Doi
5
Suthep temple.
hours!
Yep.
Talking from the front gate through to the very top of Doi Suthep.
That's how
Wow.
you prove you're worthy to study here in Chiang Mai. Not only do you have to study hard to get admission into here, even our medical students have to run up there.
I mean, all faculties that in CMU,
Of course,
right?
all faculties help each other out, and our seniors have to be the staff too. So if you're here in Chiang Mai, you get to run up the mountain and be healthy more than once a year.
I see. So I think it's called in Thai รับน้องขึ้นดอย right?
Yes.
And I think in English it's called CMU trekking. Yeah, right?
Yeah. Great.
I've heard, one of my friends was staff for this year and they told me, I'm not sure if I'm right or wrong, but they said it's 14 kilometers the first faculty, I think, start walking around 4 a.m. Yeah, I think it's just wonderful. Last year, I participated in the activity.
Wow.
And, yeah, it's kind of dark, 5 or 6 a.m. But at right around 7 and 8 a.m., you're on halfway through. You see this sort of like a very, very good scenery when you look down. You see the whole city of Chiang Mai. You see the airports, you see people are driving around, and it's rare for you to standing there with your friend on the top of a mountain.
That's lovely.
Yeah, right. And it's a great way for you to, make a lot of friendship there. You know your senior student, your friend, and some of your professor.
Each division
A professor
comprises-
joining the activity too, right?
Great. Hopefully you make both lifelong memories and best friends.
Yes.
It really is more than just an icebreaker. You might be friends with them forever.
I totally agree.
Going through tough times, stick with each other through
Yes.
both the good and the tough.
It's probably one of the top things that people think about when we're saying about CMU is รับน้องขึ้นดอย
Yes,
or
of
CMU
course.
trekking, right?
And Chiang Mai, Doi Suthep Temple is a place you can't miss. So everyone who comes here has to go.
But what's even bigger challenge is this thing, right? We are now working really hard to solve, so stay patient. Just listen to us chatting while we're working hard to make sure that the video will be delivered right on time, all right?
The video is coming soon. I saw a tiny sneak peek.
Ah! Last year, after the CMU trekking, one of my friends, whom shall remain nameless, but they are here, they went to a music festival.
Really?
Right.
Is it Chiang Yai Fest?
Yes, right after they walking a whopping 14 kilometers. They still have a strength to go to the music festival.
Well, obviously our students are incredible.
There's nothing to stop them. They got loads of ATP sparing for them.
Of course, that's why Chiang Mai University is one of the most spectacular universities, not just to study, but, for everything, for the location too.
Yeah, I totally agree. The scenery, the activity, the music, the wheels, and oh wait, I mentioned there's something about CMU that is a must go. Ang Keo, right? Ang Keo is top Instagram post whenever we are in the Chiang Mai University, right?
Right. So, your anticipation has come to an end. The video is ready for you.
The quarterfinals, initial incision. This round is made up of 30 teams. The teams will be split up into 3 divisions. Each division comprises 10 teams. The first division consists of the teams based on the total MCQ scores in ranks 1, 4, 7, 10, 13, 16, 19, 22, 25 and 28, with scores being in order of high to low. The second division are teams in ranks 2, 5, 8, 11, 14, 17, 20, 23, 26 and 29. The third division are teams in ranks 3, 6, 9, 12, 15, 18, 21, 24, 27 and 30. Each division will play separately and proceed one question at a time. The round will start off with a specific theme of anatomy involved in that question. Then, each team can choose whether or not to use an item. Each question is worth 100 points. In addition, an extra 10 times the number of teams that got the question incorrect, points will be awarded. The more teams that got the question incorrect, the more points you will gain. Furthermore, if you chose to use the item bicuspid, you will receive twice that amount of points. If you decided to use the item tricuspid, you will receive triple that amount of points. However, if you answered incorrectly, no points will be given. Items must be exchanged with points. The item bicuspid costs 50 points, whereas the item tricuspid costs 150 points. Used items cannot be reused throughout the game. After the time limit of item choosing is up, the game will proceed to 1 minute short answer questions. The correct answer will be revealed each time before proceeding to the next question. After 10 questions, the top 2 teams with the highest scores in each division will enter the semi-finals. The teams in ranks 3, 4 and 5 will pass to resurrection. In the case of a tie, we will consider 1. The team that answered more questions will receive a higher rank. 2. The team that used less items will receive a higher rank. Situations 1, then 2 will be considered respectively. The remaining teams will fall into resuscitation.
That's it for the rules of the quarterfinals. By the way, if you guys haven't noticed, your power-up items are in front of you on your podiums. So, after the topic is revealed, please show these signs if you want to choose an item. The femur is for bicuspid and the skull is for tricuspid. If any of you guys have any questions, please feel free to ask now.
All right, everyone, please feel free to raise your hand if you would like to ask us any question. All right, now I think everything is all set.
If nobody else has any questions? Right. Let the quarterfinals initial incision commence. The first topic is coming soon. And the first topic is facial anatomy. You guys have 30 seconds to choose your power-ups. Seconds. Lift up your signs if you want to power up. And time's up. Let's wait for the first question. The first question is?
What are the names of the muscles that act on the eyes as seen in the figure?
60 seconds to answer. Time starts now. Halfway through, 30 seconds. Seconds, now or never. Time's up. Put down your pens and we'll see the answers you guys have sent in. And these are your answers. Quite synchronous from our 10 teams, but there are some differences.
Yeah, some of them are two answers, some of them are only one answers. I wonder which is right.
That was just the first question, just a little warm-up.
Yeah, that's right.
I think they might get quite a lot harder.
That's true, that's true. The verdict is coming, so get ready.
And the answer will be...
Superior oblique and inferior rectus.
Congratulations, you guys, on the first question. By the way, you can use this time to appeal after the correct answer is revealed. Let's wait to see who was faster on the scoreboard. Right. Scores are in. So congrats to all of the teams that got the answer correct. But don't worry if you didn't, there are still so many questions.
That's right. It's still a long way to go, so get ready. All right, we are ready to see the topic of the next question. And the topic is gastrointestinal anatomy. 30 seconds for choosing your items begins. Time's running out. Choose your item wisely. And time's up. All right. Now, let's hear the question from our dear quizmaster.
A 1-day-old premature male newborn presents with bilious vomiting after breastfeeding. In addition to a distended epigastrium, a physical examination reveals slant eyes and low-set ears. An abdominal X-ray is shown in the picture. Give a diagnosis.
The clock is ticking. 60 seconds and counting. Thirty seconds remaining. Make it count. Last 10 seconds. There's no time to waste. And the timer has ended. Let's see what you guys have sent in. And here's are the answers.
There's quite the variety.
That is a variety of answers. Again, we have some of the answers seems to be in the majority. But I wonder, will the majority be the correct one? Second question in already. I think you guys have, get to the timing and the pace of this round.
Yep. Hopefully not too excited now.
All right, and the answer is
Duodenal atresia.
congratulations. All right, coming right up is the scoreboard for the second question. We have still on the top, two teams sharing the same rank.
Many teams, actually.
Yes, many teams are
But I don't
sharing the same
think
rank.
you guys are confident enough to choose your items yet. Now, the third topic is cardiovascular surgery. 30 seconds to choose your items. Ten seconds. Right, the next question will be with you soon. The next question is
A 6-month-old male infant presented with several episodes of acute dyspnea and severe central cyanosis over the past few weeks. He was finally diagnosed with tetralogy of Fallot with multiple episodes of hypoxic spells. A palliative surgery called the right modified Blalock-Taussig Thomas shunt was performed to improve his cyanotic condition. According to this figure, what is the name of vessel A?
60 seconds to send in your answers. Halfway. Ten seconds remaining. Time's up. That was a tricky one, seeing as your guys' reaction from only just the topic. So these are the answers. Again, quite similar.
Yeah,
You guys are doing well.
But there still is some differences. I wonder which is the correct one. Third question so far, and the question is getting longer and longer for each round, right?
I'm sure you guys are nervous but are dealing with it very well, even though it's tricky. And the correct answer is
Right pulmonary artery.
oh dear, does anybody want to appeal?
I can hear the gasp and quite a shocker in this hall, but seems like no one got it right.
It's all right. That means the scores remain the same.
That's
and
right.
we'll go on to the next question.
All right.
Just a second, waiting for the next question.
All right, and get ready. The next topic is neurological symptom. You got 30 seconds to go. Choose your item wisely. Time's running out. Choose wisely. Will this be a jackpot? And time's up for choosing your items. Get ready. And the question for this round is
A 52-year-old man presented to the clinic with left side hemifacial spasms. Physical examination showed cold contraction of left orbicularis oculi and frontalis as seen in the figure. Please give the name of the site found in this patient.
The challenge begins. 60 seconds and counting. "30 seconds, everyone. Turn up the speed." And 10 seconds only. It's all or none. And time's up for this question.
It's good to see that you guys know which topics are, the ones you're going to be able to answer correctly, your strengths. But we still saw some of you hesitating choosing the items right at the last minute.
I see.
There's quite the diversity.
I agree. And this is truly a diversity of answers here. Perhaps is that a drawing in the answer? Probably not. All right, we are waiting for the verdict. Our judges are now evaluating each team, so stay patient.
I say this style of game is quite exciting.
Yes. All right. And the answer for this question is...
The other Babinski sign.
Wow. This is once again a truly tough question. Now, don't forget, this is a time that you can make an appeal.
Quite the question. I told you it would get harder and harder.
And now that all team cannot make it to this question, the scoreboard will remain the same.
Oh, unfortunately, lots of you guys use your power-ups.
I can see that in the third, the second, and the first rank, we're coming up with 270 score. But there's still a chance, still a long way to go. You can catch up soon, so get ready.
And the next topic is innovation of the limbs. 30 seconds to choose your item. Remember, we're already halfway through. Seconds. Choose now. All right. Some very brave teams chose their items. And the question is?
A 25-year-old female is involved in an automobile accident. On the physical examination, her left lower limb is medially rotated and appears to be shorter than the other side. What is the nerve susceptible to be harmed in this injury?
60 seconds to write down your answers. .30 seconds. Make your choice. Last 10 seconds. Put down your pens. Let's see the answers you have sent. Many of them are similar, but still some variety.
I guess it might need to be a little specific. I see some sort of different level of specificity in each answers. But the verdict will be delivered by the judges, so get ready.
2 teams also use their skull power-up, tricuspid. So hopefully you guys get it right.
I
Since
hope
you're
so.
confident, so good luck.
That's a big, big bet, but the reward worth the challenge.
Of course, you need to take the risk.
Yeah, that's right.
Maybe if you get it right, those teams will be put ahead of
Yeah.
everybody else. Times 3 is quite a lot.
It's a jackpot if you got this right? This might be a good way to send you straight to the semifinals. Our judges are working really hard, so stay patient.
I wonder if this will be another flabbergasting answer. The
That's
correct
right.
answer is
Sciatic nerve.
good job, everyone. Most of the teams. We're halfway through, but the other teams still have time to catch up if you didn't get it right. And this is the scoreboard. We see now 2 teams up front are set apart from the others. Following closely behind, though, are 2 other teams.
We have the first and the second rank at 390 score, and the third and the fourth rank at 340 score. So it's still a close gap, so perhaps the remaining round will make a true decision who's going
Right.
to the semifinals.
Since the scores are quite similar and we only have 5 questions remaining, make sure to use your chance to use your power-ups.
That's right.
However, they do cost points and you can only use them once.
That's right.
If it's gone, it's gone.
Yeah, so it could be a big booster for you or a big problems for you. So choose your items wisely. All right, and now our team is working to check the system. We'll get right back in soon, so get ready.
Right, I hope all of you have calmed down. The next topic will be with you soon.
That's right. These little pause may be a good time for you to take a deep breath and get ready. All right, coming right in. Here is the next topic. Topic is neurological examination. You got 30 seconds to choose your items. Ten seconds left. Decide quick. All right. And it time's up for choosing your items. All right, let's hear the question from our dear quizmaster.
A 60-year-old man with a 5-year history of progressive cognitive decline showed difficulty in correctly performing the trail-making test B during the Montreal Cognitive Assessment or MOCA test as shown in the figure. Which brain lobe is likely affected in this patient?
The countdown begins. 60 seconds. Half a minute remaining, everyone. Only 10 seconds remaining. And time's up. All right, and here are your guys' answers.
Right, good luck to you. But we can see from this question that even with the same topic, there's such a varying plethora of the questions you can come up with.
That's right, that's right. Anatomy is a truly big field to explore, right?
And good luck to the one brave team that chose to use a power-up, even though the first time this topic came up.
That's right, that's right. This might send you to the top rank of this round. I hope you have the best of your luck. The verdict should be coming in soon. Get ready. And the answer is...
The frontal lobe.
Congratulations for 5 teams.
Great job.
All right. You can appeal if you would like to. All right, coming up in is the scoreboard.
Right now. Excuse me, I'm from Amonsorn team. I would like to ask, I think our team choose prefrontal because the question is need the patient to follow the rules, which is not just executive, but planning and executive action. So we thought the most specific one is prefrontal lobes. That's it. Thank you.
Let me explain about this. The question is specifically mentioned that about the brain lobe. So according to anatomical classification, the brain lobe includes only frontal, parietal, temporal, occipital. So that's why.
Because in some of the textbook that we read, in their reference book, they also state prefrontal lobes, not just frontal lobes. So we chose the most specifically answer regarding the examination. Because we thought if we want to answer frontal lobe, we need to, it's just like an executive motoric, like if we don't need to planning an action. But for prefrontal, it's specifically for planning because it's also correlated with the temporal lobe. So it's more for planning executive actions. That's why we chose that. And in some reference book, prefrontal also state a lobe too. That's all. Thank you.
Which textbook can you tell me the name of the textbook?
We read it in Gray Anatomy,
Gray anatomy?
if we're not mistaken.
We check wait a bit.
All right, just a second while we consider your appeal and check the accuracy.
Our judges are working hard. So get ready.
We still have quite a few questions in front of us, so take this time just to relax, meditate,
That's right.
maybe predict the next question.
We have been through a lot of neurology theme, right? So maybe it's still the same, or it might be a change in the topic. So let's see.
Also, it's great.
Hi, we have checked in gray anatomy as well. The gray anatomy use frontal lobe, no prefrontal lobe. Prefrontal, they use cortex, not lobe. And also we have asked in the question, which brain lobe is likely to affect in this patient.
This question is based on the textbook of neurology, Bradley Neurology, not the gray anatomy.
All right, and the issue has been resolved. Coming up next is the scoreboard. We are coming right in. First rank at 400 scores. Coming up the second and the third at 390 scores.
Good job, guys. The next topic is here already. It's great to see the other teams cheering our contestants on. The next topic, coming soon. The topic is hepatobiliary system. 30 seconds to choose your power-ups. Ten seconds, decide now. That's it. The next question will be here shortly. The question is,
A 47-year-old man came to the hospital with blood pressure 90-60 millimeters of mercury, pulse rate of 110 per minute, and a respiratory rate of 20 times per minute. He had hematemesis 4 times within 1 hour prior to his arrival. His urine output over the last hour was 60 milliliters. He had chronic liver stigmata, and this is the 3rd episode of bleeding in 1 year. When an NG tube irrigation is performed, the drain fluid looks like coffee grounds. His stool is yellow. What is the possible cause of bleeding?
1 minute to write down your answers. Thirty seconds. 10 seconds left. Time's up. That was quite the clinical question with such a long list of symptoms. Hopefully you guys have sent in a lot of answers. Your answers look quite good.
That's right.
I wonder which team will be at the top this time.
That's right. So we already passed our halfway, so now every question, make it count.
This will definitely set you apart from the others if you get it right.
That's right.
The other teams, even though it's coming up to almost the final question, don't lose hope yet. The correct answer will be here soon.
That's right. Our judges are evaluating, so get ready.
The answer is
Portal hypertensive gastropathy and esophageal varices.
great job, everyone. Cheer up, guys, if you didn't get it right. Let's see the scores. Oh, back up to chairing first place again.
You know, the first rank, there's always up and down, so keep your throne if you got it. All right, we're waiting to go to the next question, so get ready.
This will be the 8th question out of a total of 10.
All right, and here comes the topic. Anatomy of the limbs. You got 30 seconds to go. Time's running out. Choose your item wisely. And time's up. Wow, we have some of you guys using the tricuspid.
Good luck to our brave teams.
All right, and the question is,
A 21-year-old athlete came in with a severe ankle sprain after landing from a jump. He complained of pain and swelling at the medial side of the ankle. An X-ray showed a fracture of the medial malleolus and distal fibula. What is the diagnosis?
the clock is ticking. 60 seconds for your moves. Thirty seconds on the clock. Ten seconds left. This is no time to waste. Alright, and time's up for this question. Coming up is participants' answer. Ah, there it is.
Seems like this will be one of the last questions that will be soon to set your scores apart.
I can see some communication in the stage and on the hall. I wonder who got it right. Good luck to those who use your items. This might be your shortcut to the semi-final round.
Right. You need to take your shot now,
That's
take
right.
a risk. If you aren't on the scoreboard, you might just be coming up quite near.
And there are now few questions remaining, so make your move. Alright, our judges are evaluating and assessing your answers, so get ready.
Quite a challenging question.
Yes,
But
that's
our
right.
contestants still confident?
And the answer for this question is
Pots fracture.
congratulations!
Fantastic job to you two teams. They're also the teams that are up ahead.
That's right.
So they're still sharing first place, neck and neck.
Coming up is the current scoreboard. Wow, it's ARB and Amon's Horn coming up at 690 scores. What a whopping scores for you guys.
Let me remind you, this will be the 9th question, and the topic is limb trauma. 30 seconds to choose your item. Ten seconds to take the risk and put you guys up first. That's it. The next question is,
According to these clinical and radiographic figures, what structure is protruding from the open wound?
60 seconds. Thirty seconds only. Last 10 seconds. Time is up. This is almost the last question, but not quite. So good luck to you guys. And these are your answers. Quite the variety.
Correct. I can see a lot of bone here.
But hopefully it's a good variety as it will set some of you guys apart.
That's right. Good luck to you all.
And the correct answer is
Tailors.
Congratulations.
we're definitely going to see a change in the scores. Scores are in.
Wow. The first rank at a truly whopping 870 scores. You guys are doing it really great. Alright, guys, get ready. The next topic is orthopedics examination. 30 seconds to choose your item. seconds left. This might be your last chance. And time's up for choosing your items. Alright, the last question is...
What taste helps evaluate hip flexion contracture?
60 seconds begins now. Your last 30 seconds. Ten seconds only. This is the final call. And that's a wrap. Alright. Coming right in is what you guys has answered.
These are your last answers for this round.
I can see some faces in the answers too. I hope that's a happy face. That is a truly variety of answers. Last question, so good luck to you all. Alright, and the official answer is...
The Thomas test or the Eli's test?
Wow. What a great way to end this competition. Unfortunately, no one got it right, which means that the scoreboard will remain the same. Coming up right in a moment.
Amazing job, everyone.
Right, and wow, what a truly stellar performance. Congratulations to Team ARB and Amazon. You are going straight to the semi-final round. And of course, the team in the third, the fourth, and the fifth rank, you guys are going to the resurrection round.
Well done to all of you. The first division, please step down from your podiums and take a seat. And the second division, please come up onto the stage. Great job, everybody.
Wow, 10 questions. That was a truly hard question, right?
Very many questions that were quite clinical.
And some of them, no one got it right at all.
Yeah, even I think most people were not recognized.
In the meanwhile, feel free to dance with the team.
We will be with you shortly, so get ready. Second division, we will see you guys soon. Just take a seat for now. All right. I see you guys in the second division are extremely excited or ready to race to your podiums. So please give a warm welcome to our teams, Dararama, Khon University 1, Khon University 3, NMU 2, Pajajaran 1,
Pajajaran 2, the Powerpuff Boys, School of Medicine WU, UNAIR 1, and UPCM 2023. Welcome abroad. This is the 10 teams of the second division. Wish you guys the best of luck.
Good luck, guys. Last round, you were cheering on for your friends and the other teams. This time, it's your turn.
As you can see from the first round, it seems like that the items are the one that can make you straight through to the semifinals, right? It is a truly important thing, so make sure you consider before using it. It might be a big jackpot for you.
Choose wisely.
That's
you must
right.
know your strengths and weaknesses in this game. It's not just any normal competition.
That's
There's
right.
such a thrill to it, especially with these items.
That's right. Never underestimate the power of these power-ups. Alright, so stand by at your guys' podium. We should be coming up right soon.
We will be with you shortly. So just don't get too nervous and jittery just yet. Take this time to anticipate the next topic. Hopefully both the topics and the questions will be in your favor, so you can answer them correctly.
That's right. Like I mentioned already, anatomy is a truly big area of expertise, right?
Of course, every single subject we study in medicine
That's right.
takes quite the importance on it. It is a vital subject that leads us to many departments.
That's right. Just imagine a pure thickness of the Grey Anatomy's book. It surely tells that anatomy is one big thing for you all. Good luck. I hope those things that you have read will rest through your brain, through your mind during this second division round. Once again, there are only 2 spots for the semi-finals and 3 spots for the resurrection. Make sure you secure those spots. There can be changes in any round. It's so hard to predict, right? You never know.
Of course, and in this round, our contestants must have both good memory, wit, and most importantly, luck.
That's right. Luck is something that you might really need when it comes to the medicine. But of course, the most important thing is your knowledge that you have to spend your time reading through those textbooks. Get ready for today's competition.
And remember, even though it's a competition, you're here making new friends, new experiences, developing towards your own personal growth. So
right.
it's really about everything, your journey that has led you up here today. So great job to the winners. But if you're a little bit disappointed, don't be sad, because tomorrow you might get an even better opportunity as your journey has led to your growth here today. And you will never know until in the future when you've grown how much your past has helped you.
That's right. Maybe when you grown up, you think back of all these competitions. I hope it's all and good memories written in your journal of thought and time.
I hope even though a stressful competition, that in the future you'll develop a profound passion and love for medicine and your patience and for humanity. Like Hippocrates stated, wherever there is a love for the art of medicine, there is also a love for humanity.
Wow, so that's a truly great quote. It resonates to us all that medicine and human are always together. Also, one thing you mentioned, stress is also in medicine. It's about the management of those stress,
It's
right?
about diligence too. A good work-life balance. And remember, medical school is only just the start. You have a long way ahead of you.
That's right. Work hard always paid off really, really good.
Being here today, you're making yourself, your parents, your family, people you know proud, and hopefully it will help your patients in the future.
That's right. Just take your time. Think through of what you have read last night, last week, last month. I hope it all come around during the competition. Get used to the position, who's writing, who will be the main captain of the team, who will point you to the direction of the semifinals. I hope you find that direction. Good luck to you all.
Right. Just use this time, take some quiet, and jog your memory. Maybe some of you guys were doing a little late night study session.
That's the thing when it comes to medicine. Last night miracle. Remember to choose your items wisely.
And of course, your items do cost points. And I think now the second division, after watching their friends, they might have picked up some tricks.
That's right.
See, from the winners.
But the top spot is always unpredictable. You never know. And like I said, those items are truly the thing that will bring you to the semifinals. Only 2 spots for this division. Our team is working to solve a little of problems, so be patient. And of course, our lovely Mr. Skeleton is providing you the meantime entertainment.
Right now, just use this time to be mindful and remember you need to be both courageous, take risks, know your strengths, and hopefully that will put you at the top. As this round has 10 teams, but only 5 teams will go through. We will be with you guys shortly. Get ready, guys. The first topic is here. The topic is anatomy of the limbs. You have 30 seconds to choose your items. Ten seconds left. Time's up. Let's see what the first question will be. First question.
A 26-year-old man cut his palm at a proximal transverse skin crease with a piece of glass. 10 days after the wound was sutured, swelling appeared progressively near the site of the scar. The examination revealed an aneurysm of arterial structure underneath. What artery is the most likely to be ligated first during the vascular reconstruction?
1 minute to answer. Thirty seconds remaining. seconds. Time's up, and that was the first question. Let's see your answers. Good job, guys. Everyone provided an answer. Don't be too nervous. Let's wait for the correct answer.
Those are all the arteries in the hand, so I wonder which one is the true correct answer. Let's see, will it be the majority that is correct?
Could be quite a difficult question.
First question
trick
in
you.
already. Right, yes.
Might have to be quite specific with your answer too. We'll see.
Anatomy, right? Always be specific. Now our judges are working hard to evaluate your guys' answer. So get ready. Be patient. The verdict should be coming up soon. I can feel the excitement in this hall and on the stage.
After you had a glimpse at the first question, I guess you're all discussing right now. Hopefully not too stressed. Just enjoy the game, use your knowledge, make it count.
That's right.
Because today is the day.
Remember, if you're confident in your answer, the power-ups or the items should be on your side too. You should use it if you think you might got that shot of the question right. I can feel the anticipation. I can feel the intensity. But just first question in, I wonder what the remaining will be.
There is quite some tension on stage right now.
That's right. Never miss the beat.
But soon, after we know the answers, I'm sure everyone here will be cheering our contestants on.
That's right. I can always hear a sound of excitement, cheering whenever the answer is up. I know that you guys on the stages, and of course on the coming at the audience, are also trying to play along with our contestant on the stage as well. So,
Of course, there's quite the anticipation, sometimes even shock with the correct answers.
that's right. Last round, there are plenty of questions that no one got it right. Could this be the one?
Of course, especially one that really surprised me when most of the teams used their items.
Yeah,
They
that's
lost
right.
so many of their points.
That's
Unfortunately,
right.
made the wrong choice.
That's a big bet. But you can jump across the scoreboard if you choose your item and you make that question correct.
Sometimes when you see the topic, you can't predict what the question will be. Unfortunately, if it comes out to be too difficult, then... But we want to see who's willing to take the risk,
That's right.
to just jump up on the scoreboard. Maybe some of you guys just want to play it safe. You think your knowledge is definitely enough. and hopefully that will be the case.
Strategies are important thing when it comes to the game show. Not just knowledge, not just luck, but great strategy. Oh, and now our lovely Mr. Skeleton has his buddy. Should be keeping you entertaining as we're waiting for the official verdict.
And the correct answer is here.
Ulnar artery.
Great job, guys. It was worth the wait. You guys that got it correct, what a fantastic job. But don't worry, it's only just the first question.
It's still a long way to go.
The next topic is coming up soon.
And here's the current scoreboard. Alright, and the next topic is knee joints. 30 seconds to choose your items begin. Ten seconds left. Choose wisely. And time's up for choosing your item. Alright, and the question is,
In an anterior cruciate ligament or ACL deficient knee, which structure becomes the primary stabilizer to anterior tibial translation?
60 seconds begins now. Half a minute remaining. All right, 10 seconds remaining only. Make it count, everyone. And the timer has ended. And here's what you guys have answered. Wow. Alright, here are the answers. You see some tendon, you see some ligament. I wonder which is the correct answer. Good luck to you all. And the answer is...
Medial meniscus.
Wow, congratulations!
What a shock.
Only one team make it for this question. Congratulations again.
Hopefully, if you keep this up, it will put you right at the top.
Oh, and that's right. Coming up at the first rank at over 360 scores, followed by the second and third at 170 scores.
Quite the question. Now the next topic will be trauma. 30 seconds to choose your item. seconds only. Choose now. And that's it. The next question will be coming soon. The question is,
3 hours prior to coming to the emergency room, a 28-year-old man has a section of iron fall onto his left leg. He presents with symptoms of a swelling. On physical examination, there is a dropped left ankle and numbness at the first web space of the left foot. What is the possible arterial injury that is associated with his clinical condition?
1 minute to write down your answers. Thirty seconds left. Your last 10 seconds. Time's up for your third question. Let's see your answers. These are your answers. I wonder if it will be another shocking correct answer again.
That's right.
The questions are getting harder with longer sentences,
That's
more
right.
clinical symptoms.
You never know. It could be the majority or the minority that is the correct one. So be patient, get ready. We're all excited.
The correct answer is,
Anterior tibial artery.
well done, you guys. Cheer up if you didn't get it right. There's still so many questions ahead. And of course, first place is still far up at the top.
With a whopping 500 scores.
And second and third place coming up.
All right, the next topic is neurological symptom. You got 30 seconds to choose your item. Decide wisely. Ten seconds left. And time's up for choosing your item. All right, the question is,
A 30-year-old woman with a history of epilepsy presented with a new onset of feeling strange for 1 week. She experienced a strong sensation that the current event or experience had already occurred in the past. Which brain lobe is likely affected in this patient?
the challenge begins. 60 seconds and counting. "30 seconds on the clock. Make it count." This is your final call. Last 10 seconds. And that's a wrap for this question. And here are the answers of you guys. Wow. There seems to be a consensus here among the answers. I can see a lot of temporal lobe. I wondered if that's correct.
Hopefully, all of your knowledge has paid off and you guys get it right. But I see most of the teams still playing it safe.
That's right. Get ready. And the answer is
The temporal lobe.
congratulations!
Well done, everyone.
Coming up is the current scoreboard. Wow, we're having a whopping 620 scores coming up for the first rank.
It still remains similar. On to the next topic. The topic is facial anatomy. 30 seconds to choose your item. Ten seconds left. Choose wisely. All right. Waiting for the first question. I'm in the fifth question, halfway through. Question is?
What are the names of the muscles that act on the nose as seen in the figure?
Time starts now. Almost there. Half a minute left. Last 10 questions. Time's up, and these are your answers.
That is definitely a long name of muscle. I can see some drawing too for the nasalis, right?
Some with more than just one muscle. And I'm sure most of us have seen this picture somewhere before.
Ah, yeah,
Should
that's
be
right.
quite familiar.
From some of the textbook, if I was correct.
Drawing up some laughter in the audience.
Always,
And
always.
that's why I guess some of our teams are confident enough to start using their items. Let's see if the cost will be worth it.
And good luck to those that use your items. This could be your jackpot. Good luck. Since the name of muscles are quite long, and I'm sure the answer is a little bit specific, our teams are working to evaluate your answer.
Since we are halfway through, you guys should probably be getting the gist of it all.
That's right. Remember to use your power up if you think you're gonna be good at this question.
Your nerves are probably calming down. So only 5 more questions.
That's right.
To see if you can get in the rounds.
Sometimes the question might seem short, but the answer doesn't always need to be short as well. And this is one of the examples. Lots of names here. I can feel the excitement and the anticipation in this room. We all share the feeling. Not only just the participants on the stage, but also the audience joining us. I know that some of you are wondering whether what in your thoughts are the correct answer.
Hopefully, we will approach some clinical style questions too.
Mm-hmm.
And the correct answer is here.
Levator labii superiorlis alak nasi and inner part of nasalis.
Right, so quite a few of you guys got it right. Well done to you guys. The scores are coming up close. We're quite neck and neck.
The team UA1 doesn't have the levator labii muscle. And got correct. And why that's also the UPCM23.
It says they appeal from KKU3, right? What is your appeal link again? Go again.
The team UA1 and the team UA1 doesn't write the levator labii, but still got correct.
Well, we consider to give the score to team number 2 and team number 3 as well, to have the part of allow part of nasalis. If we consider to got all the correct answer, none of you will get the score because the second part is allow part of nasalis. Either team number 4 or team number 7 cannot have this score. So I decide to give the score to the one that give close answer. So you got the correct answer because you have levator labii superiorlis alic nasi and nasalis. But to be specific, is allow part of nasalis. But we give you score. So we also give this score to team number 2 and team number 3 as well.
Okay, thank you.
Okay, thank you.
And the matter has been resolved. And that's the voice of our dear Dr. Natisha Kampan. Thank you for the judges to resolve this concern. All right, get ready. The next topic is shoulder joint. 30 seconds and counting. Ten seconds remaining only. It's now or never. And time's up for choosing your item. Alright, get ready. The question is,
A 45-year-old male presented with a 3-month history of insidious left shoulder pain, aggravated by forward elevation of the shoulder. He had difficulty performing overhead tasks and was unable to sleep on the affected side. Reduced range of motion due to pain was found. The plain radiograph was performed and shown in the figure. What is your diagnosis of this patient?
60 seconds, the time is ticking down. Seconds remaining. Countdown alert. Only 10 seconds remaining. And the timer has ended. And these are your guys' answers. That is a lot of differences I can see among the answers.
Quite a variety of clinical diagnoses.
Now our judges are working to evaluate your answers, so be patient.
It's starting to get quite a bit more clinical.
That's right.
With all of the imaging, it's getting harder to answer.
We already passed our halfway point. All right, and the answer is
Calcific tendinitis of the left shoulder or calcific tendinopathy.
congratulations to UPCM 23. Only one team make it right.
Great job, you guys. The rest of the team, well done too.
And here is the scoreboard. We have coming up at the first rank at 620 points. Give it up, guys. We are ready to go for the next question.
The other teams making up close to the top. And the 7th topic is gastrointestinal tract. Your time starts now. Choose your items. Seconds only. Choose now if you're hesitating. That's it. So many teams, extremely courageous. And the question is?
What is the diagnosis for this patient as seen in the figure?
Wow. 60 seconds begins now.
30 seconds. Your last 10 seconds. Put down your pens, and these are the answers you have written. From what I can see, mostly all the same, and so many teams use their items.
I can see a lot of team seems to be in the same consensus of answer, should I call?
You all seem to agree.
Very best of luck for you that decided to choose your items. Some of them take a big risk. Good luck.
I think a lot of you are smiling right now.
That's right.
Quite a lucky question.
This could be your jackpot to the semi-finals.
And the correct answer is...
Rectal prolapse.
Amazing. You guys did a fantastic job. Congrats to the team still at the top.
I can see that some of the team is coming up. The use of item surely make a good reward. Alright, coming up, the topic is embryology. 30 seconds and counting. Good luck to you all. Ten seconds remaining. Make it count. And time's up for choosing your items. The question is,
A mother of a 2-year-old girl consults an ophthalmologist about an abnormality of her child's eye, which she has had since birth. The physical examination reveals an abnormality as in the picture. What is the common associated gene mutation found in this disease?
the countdown begins. 60 seconds to go. Good luck to you all. Half a minute remaining. Turn up the speed. Ten seconds remaining. It's all or none. And that's a wrap. Right. Your guys' answer should be coming up soon.
Incredible.
Incredible. Genetics. Embryo. Ooh.
The audience already so shocked just at the topic, that the question even more shocking.
This might be a big turn for some of the team. Good luck, everyone. This must be a truly difficult question. I hope you guys have a very best of luck. I wonder which gene is correct? PAX 2 or B? Now, let's hear the official answer.
The answer is PAX2 or the paired box gene 2 mutation.
Congratulations! Congratulations to the Powerpuff Boys and UPCM 2023. Only these two guys make it right. Here are the scoreboard. Wow! What an amazing turn of an event. We have Powerpuff Boys coming up really close to the top rank.
An incredible change. Good luck, you guys. The next topic is here. Topic is innovation of the limbs. 30 seconds. Seconds. Time's up. So many teams have shown up your signs again. And the ninth question.
An 18-year-old male football player is kicked in the lateral aspect of his knee. After a primary care, the field medic finds that he has a difficulty in performing ankle dorsiflexion and eversion. He also complains of numbness over the lateral aspect of the leg, down to the dorsum of the foot. What is the nerve injured in this case?
1 minute, starting now. Clock is ticking, half a minute left. Your last 10 seconds. That's it. I hope everyone has made your decision. Remember, this is already the ninth question. These are your answers. We can see two sides agreeing on two different answers.
Best of luck for you that decided to use your item. Good luck.
Hopefully luck will be on your side, and your items, the points you paid, will not be put to waste.
This could be your turn of the event.
The correct answer is
Common peroneal nerve or common fibular nerve.
great job. Half of you got it right. And the scores are in. Oh. Congrats, you guys. And hopefully, maybe the third team can make it up.
Hello. Okay. My team answered the peroneal nerve, but actually we meant the common peroneal nerve. So, can we please get if you want me to explain, I can explain and, in return.
Well, and we cannot read your mind. You have to make a decision which part of the nerve. You have to be precise and put the common in front of the nerve because other team that got the score also put common in front of the nerve. And the peroneal nerve, if we check this in TSE examination, we're not going to give the score to just the answer that just only half like this because you didn't make a decision. I know that you want to write a comment, but why don't you write it down? Because the other team have enough time to write it down.
That's why I didn't write the superficial or deep. So I just leave it as the peroneal nerve.
Well,
Please, nah.
just only, and that part, the sides of the knee, the name of the nerve that passed through that area is the common peroneal nerve. I'm very sorry, but I know your intention, but you have to write it down, okay?
โอเคครับโอเคครับ
โอเคค่ะ ขอบคุณค่ะ
All right. Thanks to our lovely professor, Vanessa Pond.
Well, it's okay if you would like to beg for mercy by using the appeal. It's okay.
Fortunately, begging for mercy here is not allowed.
Our judges are too tough because anatomy gotta be a little specific. All right. Coming up next, the topic is neurological diagnosis. You got 30 seconds to choose your items.
Last question. Choose wisely.
Ten seconds left. And time's up. The last question of this round is...
A 20-year-old woman was diagnosed with neuromyelitis optica spectrum disorder, or NMOSD. 4 days prior to admission, she developed a new onset of intractable hiccups with nausea and vomiting. MRI of the brain showed T2 weight hyperintensity signals in the tegmentum of pontomedullary junction extended to medulla, as seen in the figure. What is the clinical syndrome for this patient?
This is your last 60 seconds. Good luck to you all. Everyone, 30 seconds on the clock. This is your final call. Last 10 seconds. And that's a wrap. The answer should be coming in real soon. And this is what you guys have sent in.
For the final question, very difficult indeed.
This is a variety of answer. Good luck to you all.
I wonder if there'll be a change in the scores.
And The answer is
area postrema syndrome.
oh. Again, last question is definitely a tough question. Now that no one got this right, the scoreboard will remain the same. And here is the scoreboard.
Congratulations to the top 2 teams and the top 5.
What a stellar performance for everyone. Congratulations to Team UA1 and Unhat 1. You straight your way to the semi-final round. And of course, the team in the 3rd, the 4th, and the 5th rank, you're on your way to the resurrection. Good luck to you all, and once again, congratulations.
Indeed, a spectacular round. The questions obviously quite difficult, very clinical. Good job for making it all the way to the end, guys. The 2nd division, please take your seats so we can prepare for the next round.
Coming up is the last division of the quarterfinals initial incision.
I'm living my nightmare. It is a monster. It's in my head. I'm living my nightmare. It's in my head. I'm out of air.
We are ready for our third and final division. Please welcome our teams. Chiang Mai University, Maranatha Christian University, Khon Kaen University 2, Love is Victory, Med VNU,
NMU3, Hachacharan 3, The Anatomy Avengers, Triceps Surae, and Universitas Gadjah Mada. These are the 10 teams of the last division of this round.
Welcome all to the stage for the last division. Good luck for the upcoming round.
Set your position, get ready. Who will be the one that's writing? Who will be the captain? Who will be your spearhead? Strategy is important, guys.
Get ready, the topic will be here soon. The topic is muscles. 30 seconds to choose your items. Seconds. That's it. The first question will be here soon. Question is:
A 60-year-old woman suddenly feels pain at the right shoulder when she falls on her hand. An X-ray reveals a fracture as shown in the picture. Name all muscles whose function could be impaired from a nerve injury found in this patient.
60 seconds. The clock is ticking. Seconds remaining. Final 10 seconds. Time's up and the answers are in. Great job, everyone. What a long answer. Definitely will have to be very specific again.
Right, remember it must be all the muscle. So make sure you got it all. And also a very good of luck to those who decided to use your item.
So brave for only just the first question, and yet such a difficult question.
That's right. What a great way to start.
We are definitely opening with a bang. The answer will be with you soon. And the correct answer is
deltoid and teres minor muscles.
Fantastic job, everyone. Even though it was hard, lots of you guys still got it right, and the scores are in.
Alright, we are proceeding to the next question. Get ready. The topic is neurological examination. You got 30 seconds to go. Ten seconds. This might be it. And time's up. The question is,
A 22-year-old man is suspected to have functional weakness. The physician asks the patient to perform one side as seen in the figure. What is the name of this maneuver?
the challenge begins. 60 seconds to go. Thirty seconds on the clock. Only 10 seconds remaining. And that's a wrap for this question. Let's see what you guys have sent in.
Another extremely challenging question, but it seems you guys are up for the test in the face of adversity.
We've got lots of name. We've got lots of tasting. Some seem specific. Maybe it's the
Definitely.
same test, but they might have a lot of name, right?
Maybe.
Probably. We are about to find out soon.
Puts your memorization to the test.
And the answer is...
Hoover sign.
Wow! Congratulations! The one and only CMU! You got it right. This is the current scoreboard. It's CMU and MCU coming up on the first, one, and second rank. Good luck, everyone.
Great job, even without using any of your items. The next topic is perineum. Time to choose your items. Seconds. Coming up to the third question.
After undergoing incision and drainage of an anal abscess, a 48-year-old female suffers from fecal incontinence and numbness at skin surrounding the anus. Which nerve is injured?
1 minute, starting now. Only half a minute left. your last 10 seconds. Time's up. Hopefully you guys have sent in your answers. Great job, everybody.
Again, we see some variety of answers here.
You're all doing well. Seems like it's just a warm-up for you. We're only just starting.
We are awaiting for the verdict. Our judges are working hard to evaluate your guys' answer.
Seems to be quite a difficult decision for
That's
a difficult
right.
question.
A technical term indeed.
Hopefully you're getting the hang of it so far. And the answer is
Inferior rectal nerve.
all right. We have some guys with their hands up. Go ahead.
Hello. We are from Maranatha Christian University. We want to say that we reference this inferior anorectal nerve from the Terminologia Anatomica 2019, the new terminology, but it is the same nerve, the inferior rectal nerve. Can you please reassess that? Thank you very much.
Thank you.
Thank you very much.
Great job fighting for your rights, of course.
And here's the current scoreboard with CMU coming up top at 450 points.
And so many teams already used bicuspid.
We are getting ready for the next question. And the next topic is sexual intercourse. 30 seconds. Ten seconds remaining. And time's up. What a topic, right? The question is,
A 28-year-old man described a popping sound followed by pain and repeated tumescence during women on top sexual intercourse. After that, his penile shaft swelled without blood at the meatus, and the hematoma extended to the scrotum, perineum, and suprapubic regions. What are the anatomical defects in this case?
good luck. 60 seconds begins now. $30 remaining. Turn up the speed. $10 left. This is no time to waste. And that's a wrap. We should see your guys' answer really soon. Oh, there it is.
Again, quite a myriad of answers.
And what a truly difficult question with perhaps a very clear explanation in the question, right? Oh.
Very tricky question, but the topic sure induced a laugh from the audience.
That's right. You never know what the topic will be. Alright, and the answer is...
Tunica albuginea and bug fascia.
Alright, congratulations to the MCU and KKU too. You got this one correct. Coming up is the current scoreboard. And we have the KKU and MCU coming up on the first top 2 rank.
That was a turn of the tables. Great job to you guys. We're already halfway through. And the 5th topic is stroke. Time starts now. Choose your items. Time's up. And the question is?
A 23-year-old man was diagnosed with ischemic stroke. He presented with left-sided hemibalism. What anatomical structure is most responsible to this symptom?
1 minute, TikTok. Half a minute left. Ten seconds only. Write down your answers now. And time's up. Let's see your answers. Right. Most of them are the same.
The very best of luck for you that decided to use the item. The verdict should be coming up soon. Our judges are working hard to assess your guys' answer.
And the correct answer is
Contralateral subthalamic nucleus.
Well done, those of you who got it right. And here are the scores. Back at the top, CMU, but coming up closely is KKU2.
That is just 10 points away from the first rank. Keep up the throne, CMU. All right, the next topic is upper limbs. 30 seconds to choose your items. Ten seconds on the clock. Decide quick. And that's a wrap. A lot of you guys have chosen the item. Good luck to you all.
Going all in.
The question is,
A 45-year-old male falls on his palm and feels a pain at lateral side of his wrist. The physical examination reveals marked tenderness at an anatomical snuff box. What is the most common complication of this injury if left untreated?
clock's ticking. 60 seconds for your moves. Thirty seconds remaining. Make it count. Only 10 seconds remaining. And the timer has ended. Coming up is your guys' answer.
A wide array of answers.
Good luck to those that choose to use the tricuspid.
This question really showed that it's imperative to know your patient's prognosis more than just a diagnosis.
Right.
Seeing some similar answers here, hopefully you'll get it right.
All right, and the answer is
A vascular necrosis of the proximal fragment of the scaphoid bone.
congratulations. Coming up is the scoreboard. Once again, CMU and MCU, the first top two. Still have the diagnosis tools left.
This round is quite exciting. Scores keep changing. The next topic is gastrointestinal hemorrhage. 30 seconds to choose your item. Seconds. Good luck to the team that has chosen an item. A lot of you have already used them. And the next question.
A 44-year-old male patient presented with chronic epigastric pain for 1 year. An abdominal film showed a chain of calcification at the epigastrium radiating to the left upper quadrant around the L1 level of the vertebral body, as seen in the picture. During this visit, he had a massive hematemesis. The esophageal gastroduodenoscopy findings reveal active bleeding from gastric varices. In this case, what is the possible diagnosis and the cause of gastric varices?
1 minute, the clock is ticking. Half a minute left. Your final 10 seconds. Time is up for the 7th question. Almost at the end of this round. And these are your answers. Quite an amalgamation yet again.
What a diversity of answers.
Would definitely be intriguing to see who got it right and the scores ever changing.
I wonder which of this is the right answer. We shall see really soon.
This might be the question that chooses the winners.
That's right.
The correct answer is
Chronic pancreatitis and splenic vein thrombosis.
great job to MDCU3, the only team that got it right.
What a tough question indeed. Coming up is the scoreboard.
Great job, you guys. I see a lot of you are going all in using your items.
The next topic is elbow joints. 30 seconds to go. Seconds remaining. This is no time to waste. And time's up. All right. Let's hear the question.
An 8-year-old female falls and experiences left elbow pain 4 hours prior to the admission. The radiographic study is shown in the figure. What is the diagnosis of this patient?
The clock is ticking. 60 seconds and counting. Seconds. Make it count. Ten seconds remaining. It's now or never. Coming up is your guys' answers. There it is. There's a mix of radiology, some sort of clinical in this question.
Again, the contestants for this round have really varying knowledge. They do not agree on anything.
That's right.
But that's why the scoreboard is always changing.
Especially since we already passed the halfway point.
We are at the 8th question, racing through, almost at the end.
Right, the very best of luck of you who choose to use the tricuspid.
If you did, really risking it all for the top spots.
This perhaps could be your jackpot. And the answer is...
Lateral condyle fracture of the distal humerus.
Congratulations to CMU and MedWeNU for passing through to this question. Coming up is the current scoreboard. Oh, we have some appealing.
Hello, my name is Jeremy from Maranatha Christian University. I think if you say condylus in humerus, it means trochlea humeri and capitulum humeri, not the epicondyle, not the lateral epicondylus.
Okay, maybe I try to explain. What he meant is we think that the fracture is not specific enough to be said just condylus, because condylus is composed of the capitulum of humerus and the trochlea of humerus. So our opinion is that the diagnosis is the epicondylus.
And once more, in humerus there is not lateral and in I study there is no lateral and medial condylus, only epicondylus lateral and medial.
That is our appeal. Thank you very much.
Thank you. Actually, from the X-ray and the clinical together, this patient is a 8-year-old female, right? So in this case, we consider it as the pediatric fracture. And if we look at the X-ray together with the prevalence, we think that mostly we will find the lateral condyle, or in case maybe some of the medial condyle, but not, I mean, clinically we don't really find the lateral epicondyle fracture from, if I reference from the Rockwood surgery or the Campbell. And from the X-ray, actually I can see that it's the condylar fracture of the distal humerus. And the fracture do extend to the trochlea, I mean from the X-ray. And what you mentioned about that, I'm not sure if I listened it correctly, that there's only epicondylar fracture. Mostly, actually, from the prevalence, we found lateral condyle a lot, I mean, in the pediatric fracture. Yeah, thank you.
Okay, thank you very much for the explanation.
Thank you to our professor. We'll soon be moving on.
Right, and here's the scoreboard. Coming up at the first rank and a whopping 1,030 points for MDCU3. We are coming to the next question.
Hopefully you guys can catch up with the next topic. Embryology. 30 seconds. Remember, this is the 9th question. And it's time. The 9th question is?
A male newborn has a frequent history of choking while feeding and also has pneumonia. A physical examination also reveals a heart murmur. A contrast radiograph is shown in the picture. A defect involving which embryonic structure would result in an abnormality as seen in the picture.
Your 1 minute starts now. Half a minute remaining. Final 10 seconds. Time's up. Let's see if everyone has sent in their answers. Good job, guys.
There seems to be a consensus of answer here. Tracheoesophageal thing?
Quite a tricky question.
Indeed.
When the topic was revealed, quite shocking.
I can hear the
Definitely a
gasp,
challenge.
right? Embryology, a pinnacle of anatomy. All right, a verdict should be coming in really soon. Get ready.
Making it near to the end. So obviously lots of adversity and hurdles you have to jump over. The correct answer is
Tracheoesophageal septum.
well done, everybody. And the scores are in. Well done, you guys. Only one question left. Keep it up and you'll go through into the next round.
The last topic of this round is hand. 30 seconds to go. Make a decision. We have one tricuspid in. Ten seconds remaining. Choose wisely.
Your last chance to make it up to the top and pass through to the next round.
And that's a wrap. Good luck to you all. The last question is...
A 40-year-old male presented with the clumsiness of right hand for 9 months. Physical examination revealed weakness of the flexor digitorum profundus index and middle finger grade 3. Flexor pollicis longus grade 3. Neither sensory loss nor atrophy of intrinsic hand muscle was found. The muscle power of the flexor digitorum profundus of the ring and little fingers were grade 5. The patient was asked to perform a fist, but found it difficult to perform. What is the most likely clinical diagnosis for this patient?
Your last 60 seconds begins. 30 seconds, everyone. Rock this challenge. This is your final call. Last 10 seconds. And the timer has ended. Coming right up is what you guys has answered.
That was the last question. Good luck to all of the teams.
There it is. Last question has coming in. Our judges are evaluating.
So many different answers for such a long question.
I can see some last seconds erasing.
Good luck for the one team who is willing to risk it all to secure a spot in the next round.
Could this be a turn of the event? Good luck. The answer is
Anterior interosseous nerve syndrome.
congratulations.
Incredible. I wonder what will happen to the scores.
Lucky for you, that last second erasing serves you well. And this is the final scoreboard. We are having an appealing. All right. We are proceeding to the scoreboard. What a stellar performance. Congratulations to Team MDCU3 and CMU. You guys are straight to the semi-final round. And of course, the team in the third, the fourth, and the fifth teams, you guys are on your way to the resurrection round. Once again, congratulations to you all.
What an enthralling round. The scores kept changing. It was unpredictable. Such an enthralling game on a variety of aspects of both the foundation and clinical anatomy.
Coming right up is the resurrection round, which will proceed immediately. I would like to make some announcement. The GM will deliver your break. And just make sure that if you finish with the break, there's a place for you to, the garbage is outside of the room. There will be no break and we will proceed to the resurrection immediately. And this is the end of the initial incision.
Welcome back to the competition, everyone. My name is Apichaya, or you can call me Bob.
My name is Roisara Chautila Apha, or you can call me Polly. I am extremely excited for all 9 teams to have a second chance to resurrect to the semi-final round. And please welcome our quiz master, Konkan Mijak and Natcha Thiti Wathanakarn.
And we just came back from the quarterfinal round, and I can see that the earlier competition was very intense, wasn't it?
Totally agree. And many teams from the initial incision exhibit a very remarkable score, and I am extremely excited for this round.
Yeah, in the earlier round, we can see that all of the teams have used their items to increase their scores with their strength. So in this round, with the somatic bingo, we are expecting to see some tactics.
Right, but our tactics this round might be a little bit different from the last round.
Okay, in this round, the third, fourth, and fifth ranked participants get to join from the quarterfinal rounds, get to have a second attempt to win this game in order to ascend the competition ladder up to the semifinals. So I think we should reintroduce our contestants, but let's wait for them to enter the stage.
All right, let's do that.
Okay. Let's wait for a second. Okay, as we gear up for the intense battle, let us recap some of the game basis for you. The game that we have designed for this round is called Somatic Bingo. I bet everyone can tell from the name that the knowledge is not enough to pass through, but you will also need some tactics to maximize your scores.
All right, in this round, each team will be handed a 4x4 bingo grid, but there's a little twist. Before each question, we will drop a hinting keyword or the topic, and you will need to strategically place your question to the grid. And then we unveil the question. If your team nails it, just like in the bingo, you got that tie. But not all ties are created equal. Some come with a bonus point, and some come with the penalties. And here's some icing on the cake. Complete a horizontal, vertical, or the diagonal row, and you will got an extra incentive. And naturally, the top 2 scoring team will get their chance to resurrect their hope to the semi-final round.
That's right. However, before we show the video explanation, we want to welcome our team to the stage. Please come up to the stage. Okay. Okay, let's reintroduce our contestants. We got NMU1, MET RSU, and MET ICM from the first quarters, and UPCM 2023 and KKU1 and Powerpuff Boy from the second quarters.
And from the third quarter, we have KKU2, UGM, and MCU.
Okay. Look like our contestants have all entered the stage. We will show you the video explanation of this round again. We have 2 videos. The first video will be for the resurrection round of the contestant on the stage. And the second video will be for the resuscitation round for the team who got eliminated and want to play along with us. So our GM will send the link in the chat for the resuscitation round to join. And let's watch the video together to get a bigger picture of how the game works.
Resurrection, Somatic Bingo. This round consists of 9 teams. Each team will receive a 4x4 board. The game starts with a key word for that question. Then, each team can select the position on their board to place that question. After all the teams have picked their position of the question will be revealed and there will be a 1-minute time limit for answers. After the question has been answered, the correct answer will be unveiled and the game will carry on to the next question. All 16 questions will continue in the same way. The scoring system. A correct answer in a normal box will equal 100 points. A correct answer in the times 2 score box means that question will be worth 200 points. An incorrect answer in the negative score box will decrease your total points by 100 points. Additionally, if you get 4 questions correct in a row, column, or diagonal line, you'll be awarded 50 points per line. The top 2 teams with the highest scores will be welcomed to the semi-finals. In the case of a tie, the team that answered more questions correctly will be selected. Resuscitation, rehabilitation. This game involves 35 teams. This round will be played alongside resurrection. When the resurrection question is revealed and the 1-minute time limit for answers is set, we will open an online system to receive answers from the spectating teams that were eliminated. A correct answer will be awarded 1 point. The team with the highest score will receive a special prize for resuscitation.
Okay, and that's the end of the videos. And may I add 2 points? Firstly, with our 4x4 bingo grid, due to the timing, we have reduced the amount of questions from 16 to only 12 questions. Repeating again, only 12 questions to entries to the grid, so choose carefully. And second, for the appealing process, we will allow appeals when the answers is revealed and all the answers from the contestant is marked. In order to appeal, you can put out your hand, raise your hand to let the competition staff know, and we will quickly seek out and support you guys.
All right. If you have any question, please feel free to ask us before we continue. Okay, it seems like there's no question just yet, so we will proceed to the next agenda. And now we would like to begin the game. Please give another round of applause to our dear contestant before the challenge begins.
Okay, I can feel the anticipation, and let's dive into our pools of questions. And the first topic for thematic bingo is the skulls. You have 30 seconds to choose your grid. Remember to choose the position that would open the most opportunities. Ten seconds left. And time's up for choosing grid.
And now let's see the first question.
The question is,
a 60-year-old woman presents with a difficulty in chewing and numbness at anterior part of tongue, along with left side of chin. The physical examination also reveals a loss of taste sensation at anterior two-thirds of tongue and lower jaw deviation to the left when asked to open a mouth. A CT scan indicates a tumor at the base of the skull. Give the specific location of the lesion.
You have 60 seconds to consider your answer. start ticking. 30 seconds remaining. Ten seconds left to secure your first answer. And time's up.
Let's see the entries for the first questions. Okay, I think a lot of teams have quite a various answers with foramen ovale from UGM and KKU1 and facial nerve lesion from MCU. It is a very diverse answers.
Yes, in the very first question.
Yeah, I wonder which team get the answer right.
We have to wait and see that.
Okay.
All right, let's see our official answer.
And the answer is?
Foramen ovale.
Okay, for the first question, NMU1, UGM, KKU2, and KKU1 get the answer right with foramen ovale. Okay.
And it's time to review the rankings after the first round. And in the first round, we have NMU1 in the lead with 200 score. Oh, it seems like they already used their double score grid. And in the next place, we have KKU2 with 100 score, tying up with UGM and KKU1.
Okay, look like some group already used their bonus grid. I think everyone gotten the glimpse of how the game goes now. So without further ado, let's go to the second questions. The second topic is birth defect. You have 30 seconds to choose your grade. Ten seconds left. And time's up.
All right, moving on to the round 2. Here is your next question.
The question is,
a newborn male is identified with a congenital anomaly as seen in the picture. What is the specific period of embryonic development in which the mother was exposed to such teratogen? Please answer in week range.
1 minute for this question. Think carefully.
Thirty seconds left.
Time is ticking away. Only 10 seconds left to secure your answer. And time's up.
Okay, let's see the answers from our participant for question 2. Okay, I can see the majorities of the answers being 4 to 6 weeks from NMU1, UGM, and PPB. Okay, and other various answer being 4 to 8 weeks. So there is 2 major answers. I wonder what is
let's
right.
see if the majority got the answer right.
Okay.
I would like to see the answer of team number 1. What is your number? For week 4 to what? 8?
Yeah.
Thank you.
Let's wait for the official answers, and it is ready. And the answers for question 2 is
4th to 5th week.
so NMU 1, UGM, and PPB got the answer right with 4th to 5th weeks. Okay, get ready and let's see the scoreboard for question 2.
And the ranking is stay remain the same, with the NMU1 on the lead with 300 score, followed by UGM with 200 score and KKU2 with 100 score.
Okay, so no team have make that bonus grid just yet. The score didn't differ significantly just yet, so we are expecting to see more pronounced variation in the upcoming topics. And the third topic is sport shoulder injury. You have 30 seconds to choose your grid. Ten seconds left. And time's up.
And round 3 begin with this question.
The question is,
A 60-year-old male presented with pain and weakness following traumatic right shoulder dislocation 3 months ago. Physical examination revealed significant pain and weakness when reaching to the back seat. He had weakness when performing the test shown in figure 1 and 2. Statutal MRI is shown in figure 3. What is the most injured structure in this patient?
Let the challenge continue, and again 1 minute for this question. Second half pass. And now only 10 seconds to finalize your answer. And time is up.
Let's see the submitted answers for question 3. There is a lot of physical examination here. Okay, so
it seems like they kind of share the answer with subscapularis muscle.
Yeah, I can
and
see subscapular.
Paracaudosal nerve.
Yeah, I can see some answers with tendons, muscles, and nerves. There is a very variety of answers going on
and
here.
Team MCU also add the word tendon to their answer.
Okay, let's see the official answers. And the answers is
subscapularis tendon right shoulder.
Congratulations, and PPB, MCU, and RSU team got the answer right. Okay, get ready to see the scoreboard.
And after the third round, our scoreboard looked like this. Team MMU1 still holding on their first place, but tying up with Team Powerpuff Boy with 300 score, and followed by Team MCU and UGM with 200 score.
Okay, the first place seemed pretty tight. And all right, for the third question, you only see the grid that your team posts your position in. However, in the next question, we will make an update on every team grid. So be ready and brace yourself for the fourth questions. And the fourth topic is chest injuries. You have 30 seconds to choose your grid. Remember, high risk come high return.
Yes, and don't forget to put your tactic on the game.
10 seconds left. time's up.
All right, ready for the round 4 question? Here it is. And the question is,
Provide the name of the muscle that was injured while inserting a chest tube in the safe triangle.
60 seconds for this question. The clock is ticking. Seconds remaining. And 10 seconds remaining. Please make sure to lock in your answer.
Okay, time's up. And let's see the response for question 4. I think I am seeing a lot of internal intercostal muscles. Okay, from KKU, UGM, and PPV, KKU1. Okay, and other various answers like serratus anterior and external intercostal muscles from RSU. Can't wait to see which team got the answer right.
And also can't wait to see every team quit in this round.
Yeah, in the realm of possibilities, the odd answers can be the right one.
That's right.
Okay, and the official answers is ready. And the answers is?
Serratus anterior muscle and intercostal muscle.
Okay, congratulations every team. Look like everyone got the answers for this one right.
Yes.
Okay, for this question, everyone will get to see a grid update from every team. Let's wait and see the grid together on how everyone is doing. Okay, it seems like a lot of teams have already aimed for the bonus grid.
With KKU1 and PPB already used their
bonus
double points
grid.
Yeah.
Yeah, RSU and MU1, PPV, okay? And okay, that's pretty much all the teams that get the bonus point. And some I think, can aim for a streak. So maybe with enough tactics, you can just win the streak and get the incentives
And
too.
interestingly, Team PPB already used up their 2 double point grids.
Oh, I see that too. And I think they have a potential for winning the horizontal and vertical grid. So see all of your opponent grid. And get ready to see the scoreboard for question 4.
Oh, and here's some surprise. And now leading the board is Team PPB with a 500 score, and closely followed by Team NMU1 with 400 score, and MCU met RSU with 300 score.
Okay, I think the score is quite very close in gap, so we will be ready for the next topics. And the next topic is muscles. You have 30 seconds to choose your grid. Choose wisely. The topic is quite broad, isn't it?
Yes.
I wonder what is about the muscles.
It can be everywhere in our body, like our facial muscle, or even our head to toe.
10 seconds left. And time's up.
And here comes the question for round 5.
And the question is?
A 50-year-old man presented with sudden onset of right arm pain and swelling, as seen in the figure. What is the affected anatomical structure in this patient?
60 seconds for this question. Stay focused. left. And now you have 30 seconds left. Last 10 seconds to wrap up your answer. And time is up.
Let's see the submission for question 5. Okay. I think the answer is very diverse, but I can see bicep brachii muscles from MCU and KKU too. Okay. Some answer with attendance from UPCM 2023 and Med RSU. We can also see coracobrachialis muscles too. I wonder which team get it right. So there is 3 major answers here for question 5, and we are about to reach halfway to second 6.
Yes.
Okay, and the answer is ready. And the answers for question 5 is
Long head of biceps tendon.
congratulations KKU, PPB, and UPCM 2023 to get the long head of bicep tendon right.
I feel like they really need the specific answer to win this round.
Yeah, the official answer is very specific. And get ready to see our scoreboard for question 5.
Alright, and 5 questions through this competition. The leading team is still PPB with 600 score, followed by KKU 1 with 500 score and NMU 1 with 400 score.
Oh, I can see KKU 1 rise up to the second place, and the tension in the room is building up. And get ready to go to the topic 6, which is our
The ranking is
halfway.
keep changing. I can't wait to see.
So let's unveil our 6 topics. And the topic is flank pain. You have 30 seconds to choose your grade. Choose carefully. Ten seconds left. And time's up.
Alright, round 6 start with quite challenging topic. Let's see the question of this topic.
And the question is?
A 30-year-old male suffers from a certain period of left flank pain, nausea, vomiting, and left testicular pain. The left-sided varicocele is noted during the physical examination. The investigation reveals hematuria and proteinuria. The imaging study is shown in the picture. What is the most likely diagnosis?
1 minute countdown for this question. And 30 seconds have flown by. And now only 10 seconds left to decide the answer. And time is up.
Let's see the entries for question 6. Okay. I think there is a variety of answers with nutcracker syndrome from 3 teams and left renal vein thrombosis from NMU1. There is also left renal vein stenosis. Wow, quite a various answers, isn't it? I wonder what team get it right. There is also entrapment from NCU. There is a lot of hinting, physical presentation in this question too, isn't it? Yeah, with the imaging study, I wonder what is the most likely diagnosis. Okay. Let's wait for the official answers.
And the official answer is
Nutcracker syndrome or renal vein entrapment
seem
syndrome.
like so many teams have got it right for this question.
Yeah, the left renal vein entrapment from MCU also get the answer right. Okay, can wait to see the official scoreboard. So let's see it.
Oh, and the ranking kind of stayed the same with PPB with 700 score and KKU 1 for 600 score, followed by MCU and NMU 1 with 400 score.
Yeah, we have passed the halfway through the somatic bingo, so the other half can determine our two winners to assess.
Please remember that the ranking can be changed in every question, so basically don't give up.
Let's see if the first and second team can maintain dominance. And let's move on to the seventh topic. And the seventh topic is GI tract. You have 30 seconds to choose your grid. Ten seconds left. Make sure it is the grid of your choice. And time's up.
Let's review the round 7 question. And the question is,
The indicated structure resulted from developmental abnormality of which embryonic structure?
alright, 60 seconds for this question. Keep those minds sharp. Only 30 seconds remaining. And last 10 seconds to finalize your answer for this question. And time's up.
Okay, let's see the answers for question 7 from our contestant. There is a lot of varied answers, and I can see Vitelline dog being the majority of the answers. Out of 6 out of 9 teams have that answers, and there are also odd one like hindgut endoderms, endoderms. Oh, there is a lot of endoderms too. I think the answers is ready, and let's unveil our official answers. And the answers is
The omphalloenteric duct or ileal diverticulum or Vitelline duct or omphallomesenteric duct.
It seems like there is a lot of terms for this answer.
Yes.
So a lot of teams got it right. Congratulations. And okay, let's move on and see our scoreboard.
Oh, scoreboard has quite remained the same for so many questions. With
Yeah.
the PPP again leading with 900 score. And it seemed like they also used their third double score grid. So basically only one double score grid left for them. And followed by KKU 1 with 600 score, tied up with the UPCM 23. And followed by UGM with 500 score.
Okay, and that's the end of the 7 questions. The next question, you will get to see the update on the grid placement. So be ready and let's unveil our 8 topics. And the topic is adult fractures. You have 30 seconds to choose your grid. Choose carefully.
And don't forget to put your tactic on.
Second left. Streak planning can be a game changer for somatic Bengal too. And time's up.
All right, let's see our question for the 8th question.
And the question is?
A 65-year-old female fell and had sudden left hip pain. The physical examination shows tenderness in the left hip and limited range of motion due to pain. The pain radiograph was shown below. What is the diagnosis for this patient?
60 seconds for this question. Seconds left. And last 10 seconds countdown start.
And time's up. Let's see the diagnosis answers for question 8 from our contestant. Okay. I think I see the majority of the answers being trochanteric fractures, with some group answer with left too. Okay.
Seems like almost all of them have that answer.
Yeah.
With the PPB, the odd one out with neck fracture.
Yeah. And some also come with some pathological fractures. So let's see the answers. And the official answers is?
Intertrochanteric fracture of left hip.
Okay, almost all the team get the answers right. Congratulations. Okay, get ready and let's see the grid update from every team. Okay, I can see a lot of greens. Look like some team I have already have their diagonal win streaks with UGM, so they get the incentives. I think some group still have the potential to have the streak if they plan on putting them on the penalty grid, which is very tricky.
And the interesting is that Team UGM, if they put their answer on the minus 100 score grid and make it right, they will have the second bingo.
Yeah, there is only 4 questions left, so make sure you have planned your grid carefully. Okay, get ready to see the scoreboard. And that's the update on our scoreboard.
Oh, and the leading is PPM stay with 900 score and UGM with additional bingo score with 750 score, and followed by KKU1 tie up with the UPCM 23 with 700 score.
Okay, let's see if the first place can sustain their dominance, and get ready for the next topics. And the next topic is dental caries. You have 30 seconds to choose your grid.
I feel like this topic is a very specific one.
Yeah, I can hear the shadows from the audience.
Yeah.
10 seconds, about 10 seconds left.
Choose your grid carefully.
Yeah. Time's up.
All right, please review our 9 question.
And the question is,
A 52-year-old male developed dental abscess at left lower third molar tooth. After that, he had fever coupled with difficulty to swallowing and breathing. An X-ray showed prevertebral soft tissue swelling. The clinic team was concerned if the infection was spreading to the mediastinum. In this case, which potential space is the pathway through which the infection spread?
All right, 60 seconds countdown for this question.
look like dental caries can lead to other concerning problems.
Maybe. Or maybe they have to avoid the minus 100 grid if they're not sure with their answer.
Yeah. If they get their penalty right, maybe they can win the streak.
And 30 seconds have passed. And just 10 seconds remaining to conclude your response.
And time's up. Let's see the submission for question 9. Okay.
I feel like the answer is very various, but I see quite a lot of retropharyngeal space.
Yeah, and I can also see danger space from KKU1 and PPB2. Maybe it is the right answer, you will never know. Retropharyngeal space being the majority of the answers. Okay. So, I think we just reached the third quarters of our game, so be prepared and make sure to choose the next grid wisely. I can also see pre-tracheal space. That is a quite various of answers, very diverse one. I wonder which team have collect all of their bonus grid.
Yes. I think so many teams will already have planned that.
If the team get all the bonus grid right, maybe they could change the appearance of the game.
Yes, totally agree.
So let's wait and see the official answers.
All right, and the official answer is
retropharyngeal space.
Okay, so many teams get it right. Congratulations with the retropharyngeal space answers. Can't wait to see the scoreboard for our third quarters of the
And now
game.
let's unveil the scoreboard. The team PPB is still leading with 900 score, and team UGM follow up with 800 score, tying up with team UPCM 23.
Okay, look like there is some appealing. Please wait for the star.
Hello again. I'm very sorry. We are from Maranatha Christian University. Can we please be shown the question again, the last sentence? Okay. We think that the question cannot be, and the answer is not enough if you only answered retropharyngeal space, because the question is pathway which potential space is the pathway through. So the probable answer might be from the molar, third molar, to the parapharyngeal space, and then to the retropharyngeal space. Yeah, so that is our appeal. Thank you very much.
Hi. From the question here, we ask which potential space is the pathway. We ask the space, not the pathway. So we decide to give the score to the additive as well. You happy with this? Thank you. You're my favorite.
Thank you for the thorough explanation from our judges. Okay.
And let's move on to our 10 topics.
Okay, the 10th topic, only a few questions ahead to the grand final questions. And the topic for the 10th question is, Cliff, you have 30 seconds to choose your grade.
Choose wisely because only 3 questions remaining.
Yeah.
And it can determine your hope to resurrect in the next round.
Can't wait to see which 2 teams get to ascend out. And 10 seconds left for choosing the grade. And time's up.
Alright, and let's see the question for the 10th topic.
And the question is,
What is the main muscles that needs to be repaired in a cleft palate patient?
Alright, again, 60 seconds for this question. Seconds remaining. Time is almost up with a 10 seconds countdown.
and time's up. Let's see the response for the 10 questions. The main muscle that need to be repaired.
Oh, seems like they do share the same answer from many team with the palatopharyngeal muscle.
But I can also see palatoglossal muscle from a lot of team too. I think the odd one are tensor villi palatine muscles and orbicularis oris muscles. I wonder which team get the answer right for question 10. There is only 2 questions left, so if you have the bonus grid left, make sure to use it. So let's see the official answers for the 10 questions. And the answer is
Levator villi palatine.
It's such a twist that no team got it right for this question.
That is unfortunate, but
yes.
The answer is level 2.
Alright, only 2 questions left, so best luck for you guys.
Yeah, still 2 questions to go.
And it's time for the score from round 10.
Okay.
Holding up on top with the PPB with 900 score and UGM with 800 score with a 50 bonus point to be 850 score. And followed by UPCM with the 800 scores.
Okay, so the ranking remained the same for these questions. So there is only 2 questions left. If you are aiming for the streak, make sure that you have known your strengths. And let's move on to our 11 questions. Yeah, and the topic is eyes. You have 30 seconds to choose your grid.
It's just like a small space, but there are so many things to ask.
Yeah, there are many potential problems that could be asked from the topic.
Maybe the dinosaur, or maybe the muscle, or maybe the nerve. We don't know.
Yeah, 10 seconds left. And time's up.
And please review the question for round 11.
And the question is,
A 25-year-old man with diffuse headache 2 months. Physical examination showed bilateral upward gaze palsy. Both pupils are 6 millimeters in ambient light and 5.5 millimeters in bright light, which is sluggishly reactive, and 2 millimeters with accommodation. Where is the lesion?
60 seconds to go.
Halfway through, 30 seconds left. Only 10 seconds remaining. Please secure your answer.
Bilateral upward gaze palsies and many neurological examinations. Let's see our participants' answers for question 11. Okay, there is a very diverse answers going on here. Where is the lesion? I can see pretectal areas from KKU1 and PPB, with the of midbrain, and also NMU1 also have midbrain answers. UJM also have similar answers for that too.
I feel like the pretectal and the midband is the shared keyword for this answer.
Yeah, that being the majorities of the answers. I wonder if the majority got it right for the 11th question. So let's see the answers. And the answers is
Pretectum or midbrain.
Okay, congratulations, majorities of the team get it right. Okay, and that's the end of the 15 questions. As we are approaching the grand finale, I can see a lot of team having the potential to...
Let's see the scoreboard for our almost... Oh! And let's see the UGM taking a lead with a 1,000 score and with the more 50 plus score to be total 1,050 score for this round. And PBB also had that 1,000 score tying up with UPCM. And followed by KKU1 with 900 score.
Okay, I can see two teams at the second place.
And the next question gonna be our last question for this round. So basically, please give your best shot.
Yeah, the next question will unlock our two final teams to get to ascend their way to the semi-finals.
The ranking can change every time, even though it's already a last question. So please don't give up the hope and do your best.
Okay, let's unveil our grand finalists. And the topic is breast mass. You have 30 seconds to choose your grid for the final question.
And also in this round, we will see the grid from every single team.
Yeah, we will see the grid before the scoreboard. So
yes, so you might be calculate your score even before we show on the scoreboard.
Yeah, 10 seconds left. And time's up. Okay.
And now for the final round, let's see our last question.
And the last question is...
A 24-year-old woman presented with unilateral spontaneous right body nipple discharge which disturbed her life. The ultrasound breast shown bilateral a focal duct dilatation with intraductal mass at right breast at 3 o'clock with no other mass or ductal lesion. The ultrasound-guided core needle biopsy shown intraductal papilloma. What is the proper management?
All right, citizen, countdown for this very last question. Please be lucky. Only 30 seconds left. Time is ticking away pretty fast in our final round. And there's only 10 seconds left to give your last answer. And time is up. Let's see our participants' answer for this round.
Let's see the entries for the last questions for the management.
Very various one.
Okay, I can see lobectomies with a smile. Okay, surgical resection.
So my face a little bit of tear.
Wide excisions of lesions. Okay, modified radical mastectomies. Okay, repeat core needle biopsies in the next 3 to 6 months. That's quite specific management from KKU1. And total mastectomies of right breast from RSU. That's quite a various answer.
And let's see our official answer.
And the answers for the last question is
microdocectomy or duct excision
unfortunately,
or exceptional
none of them
biopsy
have
the
it
duct.
right to this round. And
So look like
basically,
total
scoreboard might be not
mastectomy.
changed. I don't know.
Okay, so look like mastectomy is not the right answers with our microdocectomies being the answers.
Oh,
So no
and
team get it right.
seems like there is a special case for this round, since there are two teams that have their score equal.
Oh, okay. So we have some extra round upcoming because we have two teams on
Tying
pass
up,
on the second
yes.
place, and we only want 2 teams to the semifinals. So first, let's look at our final grid bingo update. Okay, a lot of greens and a lot of red. I can see KKU2 making an horizontal streak on the last rows. So the grid is quite dense, isn't it? There is not much space left for all of the team.
But it seems like there is some team that still have a chance to get a bingo bonus score.
Yeah, with the extra round, UGM can make a streak and get the extra
But
incentive.
they have to take a risk to put their answer on
Yeah.
the minus 100 grid.
They must make sure they dodge the penalty. And let's look at the scoreboard before we move on to our final question.
Yes, very final question.
Okay.
And the scoreboard for this round, we have UGM
Being on the
tie up
first
with the PPB. We have UGM on the lead with the 1,050 score for their bonus point, and PPB tie up with the UPCM with the 1,000 score.
Okay, the tie up of 1,000 score. I think the other team, if using the bonus grid right, could potentially go up and maybe an underdog. So maybe we can
Maybe
move
the
on.
last two questions is the one that determine their destiny.
Okay, so we have we have additional 2 questions, right?
Yes.
Okay. 2 questions to go. So it is not 12 questions, but 14 now.
And
the only two teams that have to play the last two questions is Team PPB and Team UPCM 23. So basically, we already have a winner for this round at the UGM, and we have to wait for another team to be the second winner for this round.
Okay, so we have UGM as the first place. However, the second seed to the semifinals is limited. So we must have a competition of 2 questions for PPB and UPCM 2023 to see who gets to go to the semifinals.
Things is getting intense.
Okay, so only 2 teams are playing?
Yeah.
Okay. So the 2 teams get ready. And okay. Are we ready for the 13th topic? Okay, so every team can stay here on the stage. However, only 2 teams only get to submit the answer. So the next topic is pain. You have 10 seconds left for the 2 teams.
You can still enjoy and playing along with the game, but the only 2 teams that have to submit their answer is Powerpuff Boy and UPCM.
Okay, and that's time up for choosing the grid for those 2 teams.
And our 13th question is...
A 58-year-old man was referred to a local oral and maxillofacial department due to experiencing abrupt right-sided chin numbness for the past 3 months. He had underlying adenocarcinoma of lung with metastasis. What is the affected anatomical structure in this patient?
1 minute for this question.
Thirty seconds left for the 13 questions. Ten seconds left. And time's up. Let's see the submission from those 2 teams. Okay.
Okay. It seems like KKU1 have some kind of sense of humor here. And let's see the answer from PPB with the right mental nerve and the UPCM with the transverse cervical nerve.
Okay, so
one of them might have it right, or maybe unfortunately.
Yeah, the answers is not the same. So let's see which one get it right. Okay, and maybe they get to use their bonus grid or dodge their penalty and get their incentive. Okay. Let's wait for the official answers for the additional 13 questions.
And the official answer is...
mental nerve.
Okay, so PPB get the answer
get it right this round.
Okay, let's look at the scoreboard.
Alright, so now PPB is in leading.
Is in the lead for between those 2 teams.
And we have another question for our very last question.
Look like PPB also get their bingo streak.
Oh, yes, that's right.
So maybe it can be a make or break moments for PPB, Powerpuff Boys.
Alright, and let's move on to our very last question.
Okay, be prepared for our grand final questions. The 14th question for somatic bingo to determine our winners for the limited second place. Okay. How do you feel about the round so far, Polly?
I'm very impressed with all of them. Like, it is very exciting and very enjoying to watch them.
Yeah, all of the team have put their best effort in answering all of the questions. And the gap are very small, so the competition is quite intense. So let's wait for the 14 questions.
And I feel like for this round, we have kind of different the hinting keyword from the first round as our round seem a bit more like wider.
Yeah.
Like broader hinting keywords, so basically it's like a bit
it's
harder.
quite broad. Like the topic is the skulls, and as for neurological diagnosis, that is very hard to guess, especially to choose a grid form.
Yes.
Okay, let's wait for our 14 questions in the meantime. Okay, and the 14th topic, our grand finale is ready. So the 14th topic is the face.
And let's see who's gonna be the face of us today.
Yeah, there is only like 3 grid left, so there is a limit to what grid you can choose from. PPB and UCGM need to wisely choose their grid.
And only 10 seconds left. Please choose wisely.
And time's up. And the questions for our 14th topic is?
A 28-year-old pregnant woman complained of acute onset of drooping of the right face that occurred after waking up in the morning. She denied trauma to the head. On examination, the patient had difficulty closing her right eyelids, and her right nasolabial fold was smoother than the left one. She was also drooling from the right side of her mouth. The remaining physical examination is normal. What is the most likely diagnosis?
Okay, 60 seconds countdown for this last extra question.
Thirty seconds left for the last question.
And the last 10 seconds countdown begins. And time is up.
Okay, let's see the entries from these 2 teams. Okay, a lot of teams
Alright.
Okay.
Keke, you really have high sense of humor.
Okay, so we got.
And with the RSU, with the cutie picture fighting for semifinal. It's so cute.
Okay.
Oh.
Our 2 teams have the same answers
Yes.
of Bell palsy.
Let's see if they will have their answer all right for this round.
I think the deal breaker must be the grid. If they have any grid left. Okay, Bell palsy. Interesting answers from those 2 teams. The drawing.
Yes, I really love the drawing here.
Okay, and the answers is ready. And the answers is
Bell's palsy.
okay. So our 2 teams
So
get
both
the
of them
answers
have
right.
it right in this last question. And let's see our final scoreboard.
Our final scoreboard. We will also
So
get to go.
basically, PPB surprised UPCM with the two bingo bonus point and the 1,200 score. So let's officially announce our final winners for Somatic Bingo. And our two winning teams for Somatic Bingo are our leading UGM and Powerpuff Boys. Please give a loud applause for these two winners.
Congratulations. Okay, I think and that's the end of Somatic Bingo with our two teams ascending to the semi-finals. And I can feel that every team performance is very remarkable. Thank you for giving you all in our Somatic Bingo games.
I can feel that too, like especially with the constant shifting in the ranking, and our team have put their best effort into submitting their answer.
Okay, and you can get to go and have a lunch break before we are going to go into semi-final round in the afternoon of 13:45.
Yeah.
15 minutes before the 14th. So 1:45 p.m. Please come here again and let's see our semi-final round together.
And again, thank you everyone for giving their best effort and enjoying our game. And don't forget to come back here at 1:45 p.m.
Let's see our semi-final round together. I bet it would be very intense.
Yes, it keeps getting more and more intense every round pass by.
Okay, see you guys.
See you guys, have a nice lunch and nice rest.
CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University.
ฮัลโหลเทสหนึ่งสองสามโอเค
Hello? Hello? Hello, test. Hello?
a chance to fly, feeling like I'm 10 feet high. Nightmares call, you can't deny. Better find a place to hide. Time to take a chance to fly, feeling like I'm 10 feet high. Nightmares call, you can't deny. Better find a place to hide.
Good afternoon. Welcome back to the competition. Once again, my name is Natchanon Pongnoi, or you can call me San.
And my name is Parachari Ung Udan Pakdi. You can call me Namo.
I believe that all of you guys here are still exhausted from the morning competition. But this round is a little different. This is the semi-final round, or what we call anastomosis. For this round of competition, it requires speed, and only 4 teams out of the 8 teams here will qualify for the final round.
So, before we begin, I would like to introduce to you the quizmasters of this round, Miss Gongan Mijak and Miss Natcha Titi Watanagan. Now, this seems like a perfect time for us to begin our competition. This video will tell you the rules of the anastomosis game. After the video, we will have a short Q&A session regarding the rules of the game.
The semi-finals, anastomosis. This round comprises 8 teams. The game entails multiple choice questions. Each question will have 8 choices, with more than 1 correct answer per question. The game will start off by revealing the 8 choices of each question first. Then, the MC will read out the question and text that appear on screen. After the question is revealed, contestants are able to choose their answers, then press the buzzer at any time to finalize their answers. All correct choices must be answered in order to receive points. If a team has already answered incorrectly once, they shall have to wait until the remaining teams have answered until they can try again for that question. After a team answers incorrectly, once you hear the signal, the other teams will then have a chance to press the buzzer. If all teams have answered incorrectly or time is up, 2 incorrect choices will be randomly withdrawn, and all the teams will have a chance to start answering again. The team that answers correctly will gain 1 point. Then, the game will continue on to the next question. The first 4 teams to receive 2 points will enter the finals.
Okay, so before we begin our Q&A session, may I invite the 8 teams to come down to the stage. Okay, so we have our competitors on stage. Now, before we move on to the Q&A session, may we remind you once again, for the entirety of this semi-final round, you are free to hit the buzzer after you hear this signal. Then, the quizmaster will proceed to read your question. You do not have to wait for the quizmaster to finish. You may buzz in while or after the question has been read, as long as it is after the signal.
All right, and one more thing. Make sure that you push the buzzer deep down enough. Otherwise, you might lose your chance to answer. I would like to request our 8 teams here, try push one time. Deep down enough. All right, there should be something in. All right, now, if you have any questions, please feel free to ask us before we continue. All right, now that everyone clearly understands the rules, we are ready to begin the anastomosis.
Let the games begin. And for the first questions, let's take a look at our choices. You have 15 seconds before the first question starts. And time is up. So now, let's hear the question from our quizmaster. Right after this signal.
A 23-year-old man was brought to the emergency department after taking amphetamine. What is or are the symptoms that might be found in this patient?
Okay, the team that buzzed in first, UNAIR. So those are your answers. Let's wait and see if they are correct or incorrect.
I can feel the sense of excitement in this room, right? This is the first question so far.
Yes, the tension is definitely building up, isn't it?
This could be a good time for the other team to think through. There's a chance for you to steal.
So now, let's hear if those answers are correct. And your answers are incorrect. Unfortunately, Team UNAIR has answered incorrectly. But now, the remaining teams will still have a chance to take their shot. Remember, the quizmaster will not repeat the question. get ready. You may buzz in after you hear this signal.
I can hear the buzzing. One time is enough.
Some intense clicking right there.
And it's the anatomy rabbit that buzzed in first. Let's see what they have answered. There it is. 3 choices. We are waiting for the verdict. The remaining team, this could be your chance. Get ready. And their answers are incorrect, unfortunately.
It's okay, we still have a long way to go. Remaining teams, get ready. You may hit the buzzer after the signal. Intense buzzing, but Powerpuff Boy buzzed in first. Now let's take a look at those answers. I wonder if it's correct or not. Well, let us cross our fingers for this one.
That's right. The verdict should be coming in soon.
Okay, now that we are ready, so your answers are correct! Congratulations!
Congratulations to the Powerpuff Boys for making it through for the first question. Coming right up is the scoreboard. And that's 1 point for the Powerpuff Boys. Congratulations. All right. Now we are proceeding to the next question. I would like to make some announcement. For this question, there is an incorporated photo. These photos will be provided to the contestant by your respective CC. All right, there is a picture. The picture will not be shown on the screen. Get ready. And here are the choices for the second question. You got 15 seconds to look through your choice.
I wonder what the question could be.
That's right. And time's up. Let's hear the question from our quizmaster right after the signal.
A 60-year-old man presented with sudden onset of stroke 6 hours prior to admission. Computed tomography of the brain was done as seen in the figure. What clinical symptoms might be found in this patient?
It's anatomy rabbit that buzzed in first. And here it is. This is what they've answered. There it is. 2 choices. The verdict is coming. Is it a win or a near miss? The remaining team, this could be your chance perhaps. So get ready.
Take your time to think it through.
And your answers are correct! Congratulations! And that is 1 score for Anatomy Rabbit.
Geniuses indeed. So now, let's hear the official answers from our quizmaster.
The answer is A, aphasia, and E, forced eye deviation to the left.
Okay, now that we have our official answers, let's take a look at our current scoreboard. I can see Team ARB and PPB are right by each other's side.
They are now 1 point away from going straight to the final round.
Let's see who will take the cake first.
That's right.
And we are ready for the next question. Let's take a look at our choices. And we have our choices, 15 seconds, counting down.
That is quite a long choice, right?
Time is up. Competitors, get ready to hit the buzzer after the signal.
What are the signs and symptoms of benign soft tissue tumor?
Team CMU, you have hit the buzzer. Your answers are right there on the screen.
There are 5 choices made. All right.
Let's wish for the best whether they are right or not.
That's right. The anticipation is surely building. Let's see if that's the correct answer.
And your answers are incorrect.
All right, the remaining team, get ready. You may hit the buzzer right after you hear this signal. That is quite a pressing from UNAIR. Let's see what you have answered. All right, and 4 choice made. And your answers are correct! Congratulations to UNAIR 1.
Bravo!
All right, now let's hear the official answer from our quiz master.
The answers are A. Lump grows within 3 years. B. A mass with 1 centimeter in diameter. C. A mass with well-defined border. And D. A movable mass.
Right, thank you. Coming right up is the scoreboard. All right, and now we have 3 teams each with just 1 point.
Let's see who will be the first to sail across and reach the final round. Okay, and we have the choices for our next question. Take a look at them carefully. You have 15 seconds. And time is up. So, get ready to hit the buzzer after you hear the signal.
Identify the correct size associated with carnival size in the case of flexor tenosynovitis.
Oh, somebody hit the buzzer fast, all right. Triceps surae. Oh, and those are the answers. 1, 2, 3, 4, 5 answers were selected. Okay, we are ready. Let's see. Your answers are incorrect.
Now the remaining team may have a chance to answer this question right after you hear this signal. That is truly a lot of pressing from UNAIR1. Let's see what you guys have sent in. Oh, it's just 4 choices, right? And your answers are correct! Congratulations to you and AIR1. Before we proceed, may we hear the official answer from our quiz master?
The answer are A. Tenderness along the course of the affected tendon. B. Fusiform swelling of the affected digit. D. Passive extension of the affected digit is painful. And G. Finger in semi-flexed position.
Okay, now that we have heard all the answers, let's take a look at the scoreboard. And you and AIR, you are the first to have earned 2 points.
And you are the first team to go straight to the final round.
Congratulations. Now,
That's good. Now, there are 4 seats for the final round, right?
Yes.
1 has already been taken, so only 3 seats remaining for this final round.
Remaining teams, catch up fast.
There's still a chance, right, for catching on.
Yes, definitely.
I can hear a pin drop. I know everyone is exciting. Just a little moment. All right, may I Oh, okay. All right. Now, once again, congratulations to Team UNAIR1. Now it's time for you to sit back and relax. Thank you for participating in this round. We'll see you again in the final. Yes. All right, and now may I request the remaining team to try hit the buzzer one more time. It's a good time to recheck. I wonder, is that enough? It's important, right, to secure your spot for answer.
Yes, or else you'll miss your chances. Okay, now that we are done with our rechecking, we're back in the game.
All right, get ready. Here are the choices for the next question. 15 seconds to look through the choices. I can hear some talking. Perhaps some team already knows the answer, right? And time's up to look through your choices. Now it's a good time to hear the question from our quiz master right after the signal.
A 5-year-old girl asked her mother to inflate the decorating balloons for the Halloween party. Which muscles would she use during exhalation to blow the wind to inflate the balloons?
And that's a sound of Anatomy Rabbit coming in first. All right, let's see what you guys have sent in. Ooh, how many? 5 choices, right? I wonder, is that a good decision? And your answers are... incorrect, unfortunately.
It's still the first try. Remaining teams, you still have your chances. Get ready. Now, let's hear the question from our quiz master right after the signal. A lot of buzzing, but triceps sure. I'm so sorry. Pachacharan 1 has hit in first.
3 choices are being made. All right.
Okay, we are ready. Your answers are incorrect.
That's a tough question. The remaining team, get ready. You may answer right after you hear this signal. Wow. The sound effect is thrilling. And that's the sound of CMU. Let's see what you guys have sent in. That 3 choices are being made. Your answers are correct! Congratulations to CMU. You earn 1 point for this question. Now let's hear the official answer from our dear quizmaster.
The answers are C. Innermost intercostal muscle, E. Transversus thoracis muscle, and G. Internal abdominal oblique muscles.
Thank you.
Now that we have had our official answers, let's take a look at the current scoreboard.
All right. 3 remaining seats for the final round. Wow. It's just the beginning, but I can feel the tension in this room, right?
Yes, the heat is definitely building up. But I'm sure it's no match for our talented future doctors.
You know, it's not just only the knowledge, it's also the speed, right?
Yes, indeed. And sometimes a little bit of luck.
That's right. All right, we would like to request the team UGM. May you press the buzzer, please, for us? Just a recheck. Brilliant. That should be a green light. Okay, thank you, UGM. All right, now that we're done with our rechecking, we are ready to proceed to the next question in just a moment.
Okay, let's take a look at the choices for the next question.
15 seconds and counting to looking through your choices.
Time is up. And now, let's hear the question from our quizmaster right after the signal.
A 35-year-old male patient is brought to the emergency room after he was involved in a single vehicle accident. The car struck a big tree. There was a deformation to the front of the car. The patient was the driver. After initial assessment was performed, an abdominal examination shows a seat belt mark at mid-abdomen below umbilicus. Which organs do you suspect to be injured in this patient?
Wow, Team UJM already buzzed in first. And those are your answers? 5 out of 8.
The verdict should be coming in really soon.
Heartbeats are racing. Is this the correct path or a detour? And now, your answers are incorrect.
The remaining team, get ready. You may answer once you hear the signal. And that's a quick buzzing from the CMU. Let's see what you guys have sent in. 3 choices are being made. I wonder if those are correct. Your answers are... Whoa, correct! It's CMU. that hit a jackpot for this question. Now let us hear an official answer from our dear quizmaster.
The answer are C. Small bowel, E. Mesentery, and F. Spine.
Okay, now that we've had our answers, let's take a look at the scoreboard. Team CMU, you have earned 2 points, which means you are the next to enter the final round.
Which means that there are only 2 remaining seats left for the final round. Halfway through, right?
Yes, our tickets are running up.
I can feel the anticipation is building. 2 seats left, guys. Good luck, everyone. Right, thank you, CMU. All right, and here are the choices of the next question. There it is. You got 15 seconds to look through your choices. This could be a good time to think it through. And time's up. Now let's hear the question from our dear quizmaster right after you hear this signal.
A 20-year-old woman is diagnosed as an anti-NMDA receptor encephalitis. What is or are the clinical features found in this patient?
That is a quick buzzing from the Powerpuff Boy. Let's hear your answer. Single choice are being made. And your answers is... unfortunately, it's still incorrect.
Remaining teams, get ready. You may hit the buzzer after the signal. Amon's Horn, you are the next to buzz in. That is an interesting set of answers. Okay, your answers are incorrect still.
Wow, must be a tough question indeed. The remaining team, hand on your buzzer. You may answer right after you hear this signal. And that's a buzzing from Triceps Surrey. Let's see what you guys have sent it in. 3 choices. The tension is palpable. All right, let's see. Your answers are... still incorrect, unfortunately.
Now, remaining teams, on your mark. Hit the buzzer after the signal. Anatomy Rabbit, you have buzzed in. Let's take a look at those answers. 2 choices out of 8. Hope that you are confident and let us cross our fingers whether this is the correct answer. And your answers are... incorrect.
Wow, what a tough question indeed.
Definitely.
Remaining team, hands on your buzzer. You may answer right after you hear this signal. It's Patajaran 1 who's coming in first. Let's see, what are the choices you've made? 3 choices. And your answers are... still incorrect. Really tough one indeed.
Definitely a tough nut to crack.
That's right.
But remaining teams, you still have your chance for a go. So get ready, hit the buzzer after the signal. UCM, you have hit the buzzer. Now let's take a look at those answers. 3 choices selected out of 8. And your answers are incorrect.
Wow. I can hear a gasp among the hall and the audience here. This is, once again, a truly tough question. Wow, I wonder who's gonna make this question right. All right. Okay. Now, this is a definitely hard question. It seems like no one can answer this question correctly. Now, we will proceeding to our protocol. We will randomly select out 2 choices. Those choices may be correct or not. It doesn't matter. What matters is you must answer the remaining choices correctly. And here are the remaining choices. So 2 choices will be eliminated. Just only 6 choices left. And that means that all the team, you have the right to answer. All right? So because every team has already answered, right?
So now take your time to think this one through.
The remaining choices should be coming in soon. This is a good opportunity to think it through. All
we
right,
have it.
and here are the remaining choices. All right, get ready. You may answer right after you hear this signal.
And Anatomy Rabbit, you are the first to buzz in. This time it's 4 answers out of 6 selected. Now let us wish for the best. So, your answers are correct! Congratulations! A big round of applause for Anatomy Rabbit.
All right, and now let's hear the official answer from our quiz master.
The answers are A. Ovarian teratoma, B. Dysautonomia, C. Seizure, and E. Disorganized thinking.
All right, thank you. Coming right up is an official scoreboard for this round. All right. All right, and Anatomy Rabbit is another team that is straight to the final round. Namo, this means that how many seats are left?
Last spot left.
Last seats left. This is indeed a final call.
So be on your feet, guys. Now, let's take a look at the choices for the next question. And we have all our 8 choices. You have 15 seconds before the question starts. And time is up. So now, let's hear the question from our quiz master right after this signal.
A 3-day-old male newborn has not passed meconium since birth. A colorectal examination reveals a tight sphincter tone and a burst of stool. During further investigation, which of the following structures could also be found abnormal in this patient?
And well, that's a Powerpuff Boys who hit in first. These are their answers. And your answers are? Oh, it's still incorrect.
Don't give up, the night is still young. So remaining teams, get ready. Hit the buzzer after the signal. Some hard buzzing right there, but Tricep Sure, you got it first. Your answers are 1 out of 8. Hope you are confident because we're about to have them unveiled whether it's right or wrong.
That's right.
So, your answer is incorrect.
The remaining team, hands on the buzzer. you may answer right after you hear the signal. And that's a Moon's horn coming in first. Let's see their answers. Now, there are 3 choices. We are waiting for the verdict. Hold on tight. Your answers are still incorrect.
Remaining teams, get ready. Hit the buzzer after the mark of this signal. UGM buzzed in. Now let's take a look at those answers. 2 choices selected out of 8.
Will they celebrate or recalibrate? Let's find
Indeed.
out.
So, your answers are incorrect still.
This is once again a tough question. Remaining team, get ready. You may answer right after you hear the signal. And that's Pachacharan 1 coming in first. Let's see what are your selection. 3 choices are made here. And okay, it seems like it's still incorrect.
So, every team has had their first try on the question. We will now eliminate 2 random choices. Mind you, one of them might be the correct answers. But to earn the points, you must answer all of the remaining correct answers.
The remaining choices should be coming up soon.
Yes, let us take your time. Here we have them.
Alright, and these are the 6 remaining choices. Get ready, hand on the buzzer. You may answer right after the signal. That's a Powerpuff Boy! Okay. Let's see. Okay, 3 choices are made. Ooh. I can hear the gas in the audience, right?
Maybe somebody got it.
Oh, and their answers are... Ooh, it's still incorrect. Oh, wow.
This is definitely a difficult question, isn't it?
Indeed.
But maybe the remaining teams got it. So get ready. Hit the buzzer on the signal. Amon's horn, let's take a look at those answers. 3 choices selected. Let's see if it's right or wrong. And we have it. Your answers are incorrect.
The gas is overwhelming in this hall.
Yes.
But this is a chance for the remaining team. Get ready. You may answer right after you hear the signal. And that's a buzzing from Pachacharan 1. And here are your selection. Oh, 2 choices are made. The moment has arrived. Is it a triumph or setback? Your answers are... Oh, it's still incorrect.
This is really an intense one, isn't it?
That's right.
But don't worry, I believe the correct answer is just a heartbeat away.
That's right.
So, remaining teams, get ready. Hit the buzzer on the mark of the signal. Tricep Sure, you have buzzed in. 2 choices selected out of 6.
Hold on tight. We are about to discover if that answer shines.
Yes. So, your answers are... incorrect.
I can feel that some of the audience wanted to jump on the stage and play it right now.
Yes, I can hear a lot of gasping right now.
The tension is filling up this room. The remaining team, I hope you make it right. Good luck. The remaining team, get ready. You may answer right after this signal. And that's UDM. And here are your selection. Wow. One single answer. Melanocyte. Ooh. Your answer is... Oh, it's still incorrect, unfortunately. All right. This is a truly tough question indeed, and all the team has already taken their second try. All right, now we will remove once again. All right, we really helping you guys out. These are only 4 remaining choices. I wish you the very best of luck before we proceed. 1 seat left. Good luck. And you, get ready. Hand on the buzzer. You may answer right after this signal. Oh, it's Powerpuff Boy once again coming in first. Perhaps this could be a strategy. Just answer it all, right?
We never know.
And your answers are... Congratulations to the Powerpuff Boys! You are going straight to the final round. That is indeed a big celebration to make. But alright, let's hear our official answers from our quizmaster. Ooh.
The official answer are B. Malleus, D. Melanocyte, F. Dentin, and H. Geniculate ganglion.
Thank you, our dear quizmaster, and congratulations once again to the Powerpuff Boys. You are now on your way to the final round.
Okay, as we have it on the scoreboard, our winners to the final round are Team CMU, UNAIR1, Anatomy Rabbit, and finally, Powerpuff Boys. Congratulations on the 4 teams. Give them a big round of applause.
All right, we will see you guys once again during the final round. Now we will have a 15-minute break session before we proceed to the final round. Thank you, everyone.
Have a good rest, everyone.
Good luck.
CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of Medicine, Chiang Mai University. Participants are medical students from various countries around the world. The first CMU-IMC was held as a part of the 55th anniversary of the establishment of the Faculty of Medicine, Chiang Mai University. And CMU-IMC 2023, Basic to Clinical Anatomy. For this year, CMU-IMC 2023 guarantees to bring you the most memorable medical challenge ever. Starting from the preliminary MCQ round to the grand finale, the competition promises to enrich your medical knowledge. Not only will you gain academic expertise, but you will also gain global companionship and connect with other competitors. Furthermore, you have the opportunity to immerse in the unique culture, tradition, and hospitality of Chiang Mai through numerous activities. Join us at CMU-IMC 2023 for these exciting experiences. CMU-IMC stands for Chiang Mai University International Medical Challenge. It is an annual international academic competition held by the Faculty of
Welcome back, everyone. I hope you enjoyed your break.
And finally, we have arrived at the final round, polysynaptic.
Let's give us a big round of applause. First of all, let us introduce ourselves. My name is Natcha Mana Wongsakun, or you can call me Cha Cha.
And my name is Apinat Shushan, or you can call me Park. We are the hosts for this final round of the competition.
And in this round, there are 4 teams participating in the polysynaptic game.
Yes, that's right. And if you guys heard your team name, you guys can come up right on the stage. And please make sure you don't have any electronic devices with you. So let's welcome team UNAIR1.
And the second team, Anatomy Rabbit.
Followed by the third team, CMU. And last but not least is team
Powerpuff Boys.
The team that have been able to make it to this round are certainly very strong candidates for the winner position.
Exactly.
Each team already has a proctor standby, so if you have any technical issues or encounters any problem at all, the proctor are there to help you.
That's right. And in this round, we also have the same board of judges as the previous rounds.
Also in this round, we have Mr. Gonkan Michak
And Miss Siwan Chu Prai Sirikun
as the quiz masters who will address the cases, questions, and answers for us.
That's right. Now, let's talk about the polysynaptic game briefly. You will be given a clinical case containing short answer questions. You have 1 minute per question.
By answering the questions, you will earn tokens and use those tokens to buy lab investigations. Then answer the questions from the information you have.
And by doing so, you'll earn points. These points will be accumulated through the polysynaptic game. Then, the team with the highest score, with the highest points, will be the winner of CMU-IMC 2023.
Now I think it is time to proceed with the rules to the video of the final round, also known as polysynaptic.
The finals, polysynaptic. The finals consists of 4 teams. A clinical case study will appear along with 3 questions. Each question is worth 5, 10, and 15 tokens respectively. You will have 1 minute per question to answer. After all 3 questions have been answered, contestants will have 5 minutes for selection of lab tests and physical examination, which will have to be exchanged with tokens. Every team will start off with 30 tokens, plus the tokens gained from answering the 3 questions beforehand. After that, there will be 5 short answer questions concerning the definitive diagnosis of the case, which will take 5 minutes. At the end of each question, when time is up, all teams will have to show their answer, and the scores will be given afterwards. All 3 case studies will proceed in the same way. The team with the highest total score from the short answer rounds of the 3 case studies will be deemed the champion of the 8th Chiang Mai University International Medical Challenge.
And that is the rule explaining the polysynaptic game. If you have any questions, feel free to ask your proctor. You can take your time. And the proctor, please raise your hand if your team is ready.
All right, now is the proper time to begin the final round.
Let's start with the first clinical case. Now, Quiz Master, can we have the first part of the first clinical case, please?
A 30-year-old woman presented with progressive numbness which began below the belly and descended to bilateral feet for 1 week. One day after numbness occurred, she noticed that she had weakness of bilateral legs, difficult urination, and defecation were also reported.
And the question is,
Which is the structure of the nervous system that is most likely to be affected?
Your 60 seconds starts now.
now.
10 seconds left. Time's up.
The answers will be shown shortly.
I hope you guys answer it correctly.
Absolutely. I hope you answered this question correctly and earn 5 tokens. And the answers are ready. Let's hear the answer of the first question. And the first question's answer is
The spinal cord.
Now, let's go on with the second part of the clinical case.
Physical examination showed motor power grade 0 of the lower limbs. Impaired sensation and vibration were noted below the belly. Brisk reflex were noted in the ankle and knee.
And the question is,
Where is the lesion according to spinal cord level?
your 60 seconds start
now.
now. Ten seconds left. Time's up.
The answer will be displayed shortly.
And if you answer this question correctly, you earn 10 tokens.
That's right. So if you also answer the first question correctly and this one too, you'll earn 15 tokens.
That's right. And now the answer is ready. So the answer for this question is
T10 level, or the answer of T8 to T12 are also correct.
I hope you got the answers correctly. Now, let's move on to the third part of the case. And the third part of the case is
A special test was performed and showed the result as seen in the figure.
and the question is
What's the specific name of the sign?
your 60 seconds start now. Ten seconds left. Time's up.
we'll wait for the answers for a bit.
And this question is worth
15 tokens.
exactly.
So in total, if you answers all of the 3 questions correctly, you'll earn 30 tokens. And now, let's hear the answer. The answers are
Beaver's sign.
Thank you, Quiz Masters. Now you have earned the tokens from answering questions, and you will also get 33 tokens.
Then you'll choose lab investigation you want and exchange your tokens. You have 5 minutes to do so before we are moving on to the next part.
All tokens left over will not be counted as points toward the end of the round.
And the lab investigation will be shown on the screen.
Each lab investigation requires a different amount of tokens.
You can choose as many lab investigations you want as long as you have enough tokens to do so.
And in the case you wanna,
Seems like we do have an appeal.
We are trying to appeal for number 2. I think we answered spinal level T 11 to 12, with maybe possible of conus medullaris, but didn't get any points.
From the conus medullaris, there is a variant of conus medullaris. Usually, the conus medullaris will terminate at T1 vertebral level, but for some variation, it could terminate down to T3 level. So, sorry, it usually terminates at L1 level, and for some variation, it could terminate down to T3 level. So, I think it might be more than the level that should be in this patient.
From my thinking, I think we don't know if the lesion like compressed the whole. I mean, we didn't see the X-ray or MRI yet, so we don't know if the lesion is big enough to compress. It might be compressing like the under T10 level to the conus medullaris. Like that might be like a tumor or something that is quite big. So we answered both conus medullaris and T11 spinal cord below.
Now we'll wait for the judges to make their decisions.
That's right. To see that your answer is valid or not.
Okay, we granted the score to you because if it is a mass lesion, like you said, it could be possible that it might compress many levels.
Wow.
Could you repeat that again, please?
Okay, then we give the score to you because if, like you said, if for your reason, if it's a mass coursing, it could be cause multiple level of spinal cord.
Okay, thank you.
Excellent.
Congratulations to Powerpuff Boys earning extra tokens. So now we'll go back. Yes, so the lab investigations will be shown on the screen and the timer will be reset.
That's right. And your 5 minute starts
Now.
3 minutes to go. One minute left. Time's up.
Now the teams have exchanged their tokens with the lab investigations.
I hope the lab investigations you chose are beneficial and able to help you find the answer you are looking for.
Absolutely. After this, the teams will be presented with 5 short answer questions about the definitive diagnosis of the case.
You have 5 minutes to answer 5 questions about the case, each worth 10 points.
You have to type in short answers and please be aware of your spellings.
You can always see the lab investigations you chose by pressing the button on the upper left corner of the screen.
And now we're gonna wait for the 5 short answer question for a bit.
And I wonder, what is the maximum tokens that each team can have, Shasha?
The maximum tokens for the lab investigations? The maximum tokens for the lab investigation would be 60 tokens.
That's right, because it is if you answer all the questions correct, you can get 30 tokens and free 30 tokens.
That's right. Now it seems that all of the teams are discussing about the lab investigations and the case. And as we mentioned earlier, that there are so many lab investigations to choose from.
So you cannot have them all, if I'm correct?
That's right, because each lab investigations require a different amount of tokens.
So you must choose it wisely.
Absolutely. And all of the teams are working hard on this.
That's right. I can feel the heat and tension right now.
Me too. The questions will appear shortly, so stay with us. And also, as mentioned before, the teams will be presented with 5 short answer questions.
Each word 10 points. So you can have 50 points as a maximum score for this case.
Right, so you'll have maximum of 50 points and it will be accumulated throughout 3 cases. And we will see who will have the highest points to be the winner of the competition.
Absolutely right. And now the question is ready.
And the 5 short answer questions are:
Number 1. What is the diagnosis of this case? Number 2. What is the target of the antibody found in this disease? Number 3. What is the initial management for this case? Number 4. What is long-term management for this patient? And number 5. 4 months later after treatment with rituximab. She had a new onset of left-sided weakness. She was diagnosed with progressive multifocal leukoencephalopathy or PML by John Cunningham virus or JC virus. What specific neurological cells is the target of this virus?
Your 5 minutes start now.
now.
3 minutes left. Sixty seconds to go. Thirty seconds left. Time's up.
After this will be the answers of those 5 short answer questions. And it will take some time before the answers are ready.
And now the answer is ready.
The answers are the answer for question 1 is
Neuromyelitis optica spectrum disorder, or NMOSD.
If anyone would like to appeal for this answer, please do so right now. Seems like we have an appeal from Team CMU.
That's right. So let's wait and hear what they want to appeal.
Excuse me, I'm from CMU team. I just want to ask a question about this diagnosis. Do we have to add the spectrum disorder at the end of the neuromyelitis optica? Is it needed, or just the NMO is adequate for the answer?
Actually, the correct name of this disease is NOSD, but I think we will grant you the score for just neuromyelitis optica, or NMO.
Thank you.
Wow, congratulations to the CMU team.
And as mentioned earlier, these answers worth 10 points each.
The answer is aquaporin 4 or AQP4.
And if any team would like to appeal for these answers, please feel free to do so right now.
And the answer for the third question is
Intravenous steroid or methylprednisolone, plasma exchange or plasmapheresis, and intravenous immunoglobulin or IVIG.
do anyone want to appeal for this question? It seems that Team Anatomy Rabbit would like to appeal.
So we put the answer as oral corticosteroids. So does this is a correct answer, or maybe we have a partial because the drug is correct, but the route may be incorrect, but maybe have some partial credits.
So Team Anatomy Rabbit would like to know if their answer would earn some points. Let's see what the judges would say.
For the treatment if there is any team answer corticosteroid, okay, we will give because the evidence-based treatment of acute attack of neuromyelitis optica spectrum disorder is intravenous steroid or IV methylprednisolone. So we can give the score to team that answer methylprednisolone or corticosteroid, but oral is not adequate to treat the patients.
Okay, thank you.
Thank you so much, our judges. From CMU team, so the answer is, do we have to answer all of the treatment or just one, just intravenous steroid is enough for these questions?
You can choose just one because they are in the evidence-based medicine is equivalency.
All right, so does any team would like to appeal? Okay, and the answer for the fourth questions are
Immunosuppressive drugs, including azathioprine, myclophenolate, mofetil, methotrexate, rituximab, mitocentrone, eculizumab, or cyclophosphamide.
Okay, so that's the answer for the fourth question. And if any team would like to appeal, please feel free to do so right now. It's from CMU team again.
Excuse me, I'm from CMU team, and I just want to ask about the long-term treatment. I guess the question is about the maintenance phase of the treatment of NMO, and I just want to know if I answer of the oral prednisolone, is it enough for the treatment of the NMO in maintenance phase? Thank you.
For the oral prednisolone, it can be used as like a adjunct treatment for the long-term management, but it is not the main medication for long-term management. So we will give score only the immunosuppressive drug that is the main long-term management medication.
Do we have any other team that would like to appeal for this question?
Okay, so if no appeal, we will move on to the answer of the fifth question. And the answer is
oligodendrocyte.
And those are the 5 answers of the first clinical case. For this question, do we have any team that would like to appeal? All right, I don't think any of the team would like to make an appeal.
that's right. So we will now move on. Is that right? And we will wait for our judges to evaluating your answer.
By answering all of the 5 questions correctly, you'll earn the maximum of 50 points. Now that we're waiting for the scores that every team got, shall we talk about some of the prizes, Park?
I think so. So now that we are in the final round, I think our 4 competing teams will be quite interested in the prize of the winning this competition.
Right, so there are, for the prizes for the teams in the final round, there would be 4 prizes, right?
Exactly.
So the prizes for the third runner-up would be medal merits. Sorry, merit medals.
And the second runner-up, trophy and bronze medal.
And for the first runner-up are a trophy and silver medals.
As for the winner of CMU-IMC 2022, will receive a champion trophy and gold medals.
Exactly. So I hope those are the prizes that the teams would be looking for, and maybe some of them would be aiming some of the trophies or the medals.
Absolutely.
And we'll be waiting for the scores, and I hope the wait will not be long. And after this, we will see the participants answer. But we'll have to wait for a few seconds. Let's see the participants' answers. I suppose it's not ready. It is ready. So this is the answers from UNAIR1. So they got the total score of 40.
Okay, seems like they would like to appeal. Okay, we are all good because they got the question 3, 4, and 5 correct. So they got 30 points for UNAIR1. And we will have to wait for a little bit for the answer of the second team.
And now the answers of the second teams are ready. Let's see what their answers are. I suppose we have to wait a bit longer.
And it's already shown on the screen for Team Anatomy Rabbit.
So Anatomy Rabbit got question 1 and question 2 correctly. So the total score is 20.
And next is the answer for the CMU team.
And CMU team got 4 answers correct, so they got 40 points in total.
And next one, we will move on to the answer for the Powerpuff Boys team. And they got 1 question correct, so they got 10 points.
Hi, we're from Powerpuff Boys. Can we ask why our question 3 is incorrect? It's corticosteroids.
Your question 3 is correct. There's something wrong about signing. So the points of this question for you would be 20.
Okay. And for question 4, we answered natalizumab, which is the immunosuppressant for MS, which is, I mean, if we try to be the most specific as possible, but I think if the first team got scores for immunosuppressant drug, can we maybe get a little bit of that too? Because it's immunosuppressant drug for multiple sclerosis.
For multiple sclerosis and for multiple sclerosis and OSD, these two are different disorders, and some medications of MS can worsen the symptom of an OSD. So we can give the immunosuppressant that is specific for MOSC only.
Oh, okay. You said you can only give immunosuppressant drugs for that is specific for animal only, right?
Yes. But I think if you answer immunosuppressant is okay. But if you answer the wrong immunosuppressant that has no evidence, is like I told you, it might make the disease worsen, make it more relapse. So it's harmful to the patient. So we cannot give score to natalizumab.
Okay, thank you.
Okay, all right. Thank you very much, our dear judges. And right now we will wait and see the scoreboard. And the scoreboard is displayed on the screen right now. So the leading team is from CMU.
And followed by U and AIR1, which score 30 points.